Oluwaseun. It's an honor to be your MC and anchor for this occasion. We'll do proper introductions later on, but we just want to thank you again on behalf of the board and management of DRASA Health Trust and welcome you to the celebration of our 10th year anniversary. I say our because I had the honor and the very particular privilege of anchoring the very launch of DRASA Health Trust 10 years ago. And since then, this is the first major event for DRASA Health Trust. So I'm personally delighted to be here. And it's a great privilege to be celebrating an organization that has done phenomenal work over the last 10 years. Ladies and gentlemen, to start properly, we're going to have a rendition of the Nigerian national anthem. So I'm going to humbly ask that you please rise to your feet as we have a rendition of the Nigerian national anthem. And that third verse serves as prayer. So can we just put our hands together? Now I'm going to humbly ask that you please remain on your feet. And the fact that you're remaining on your feet is a good sign, because we would like to honor the memory and honor the life of a phenomenal woman whose sacrifice and dedication is the reason why we're here today. We honor the life of Dr. Ameyo Stella Adadevoh, born the 27th of October 1956 and went to be with the Lord on the 19th of August 2014. Can we celebrate her life with a round of applause as we take our seats? That round of applause, another round, another round, another round. We're talking about a hero, a real life hero. Thank you so much. You may have your seats. As kids, watched movies of superheroes and people who changed the world. We're celebrating the life of a woman who, quite frankly, saved our lives. We can actually, say it that way. And that's why we're here today, to honor the work that the foundation, the trust, set up in her remembrance, and to continue her legacy, the phenomenal work they've done over the last 10 years. One more time, we say good morning to you and welcome for us to go on. We're expecting the Chief of Staff to the President of the Federal Republic of Nigeria, the Right Honorable Femi Gbajabiamila, to join us. We also have with us, and we're very delighted to, the Honorable Coordinating Minister at the Federal Ministry of Health and Social Welfare, who's ably represented by Dr. Nse Akpan, the Director, Port Health at the Federal Ministry of Health and Social Welfare. Can we welcome him with a round of applause? We also are expecting the Director General of the Nigerian Center for Disease Control and Prevention, and so when he comes, we'll give him the recognition he deserves. We have a former Honorable Minister of Health present, Professor Onyebuchi Chukwu, as well. Can we honor him and recognize him? He came right on time and has been here for the last hour plus. You're very welcome, sir. We'd like to also greet and appreciate all directors of our federal and state agencies. I know we also have the Chief Veterinary Officer of Nigeria, Dr. Samuel Anzaku, who's represented by Dr. Salome Bawa. You're very welcome. We have several other directors from several agencies. As the event proceeds, we'll attempt to make these recognitions and name callings as much as we can. We also have representatives of federal and state governments, funding and technical partners, members of the diplomatic community and development partners, leaders of business and philanthropy. We would like to specially welcome our board of trustees for DRASA Health Trust. Can we welcome the DRASA Health Trust Board of Trustees, Board of Advisors, Team DRASA. Is Team DRASA in the room? Can Team DRASA make some noise? All right. We also have a lot of family here, people who are members of the immediate family and those who are partners and friends. They might as well be family. We also welcome. Let's put our hands together for family members. They are the ones who came from Lagos and brought Lagos traffic. But we want to welcome you all, our friends. Ladies and gentlemen, without further ado, we want to actually get into the meat of the matter. We're celebrating 10 years of DRASA Health Trust, and a lot has happened over the last 10 years. I was looking somewhere, and I read that over the last 10 years, DRASA Health Trust has trained over 15,700 health workers. Come on, 15,000. And even more significant is that they've developed a network of 96,800 health champions. 96,000. That's, in fact, we can say 100,000 over the last 10 years. And so today we're going to chart the course for the next 10 years and beyond, and hopefully we can start looking at 200,000, even 1 million partners and health champions. But we want to tell you this story over the last 10 years. It's been a lot of work. And allow me, just before we tell the story, to recognize a woman who has been a force to make all of this happen. It's taken a village, the board of trustees, friends, partners, but one woman has been spearheading a lot of the activity and is a force to be reckoned with. Ladies and gentlemen, the managing director of DRASA Health Trust, Mrs. Niniola Williams. Can we just celebrate her? Come on. Can we just celebrate Mrs. Niniola Williams? Come on, ladies and gentlemen. If it's a standing ovation, make that proper. Well done, Niniola. We say well done, well done, well done. And congratulations to you. So we want to show you the work that Nini and her team have done over the last 10 years. It's a short film, and this is the premiere. So welcome your neighbor to the premiere of the DRASA Health Trust short film. Tell your neighbor, welcome to the premiere. The only thing that is missing from this premiere is popcorn. That's the only thing missing from this premiere. But we're going to dim the lights a little bit, and we want to show you this film for the next couple of minutes. So happy viewing.
10th anniversary.
Happy 10th anniversary.
Happy 10th anniversary, DRASA.
Happy 10th year anniversary to DRASA. Kudos to you.
In 2014, a Liberian diplomat arrived in Lagos, Nigeria for a regional conference. He fell ill at the airport and needed urgent medical attention. He was taken to a private facility, which was the hospital where my aunt, Dr. Ameyo Stella Adadevoh, worked for over 20 years. Initially, when he was admitted, he was being treated for malaria. But when she saw him the next day, she immediately suspected that he had Ebola, and she started working with her team to put in the necessary protocols. They didn't have a lot of training or knowledge on what to do, but they did their best to try and contain the virus. Unfortunately, the man insisted on leaving the health facility to attend the conference. And it was at that point that my aunt refused. She absolutely refused to let him go. And in the process of that, she was infected. If he had left the hospital and attended that conference, we would have had a continental disaster. The conference was an ECOWAS conference. So West African dignitaries, diplomats, and heads of state would have been present, and he would have been able to infect all of them. What she did saved millions of lives. We can't even count how many. It was after she died that we realized we needed to do something.
DRASA was set up at a very difficult time for my family and for me, after the loss of my mother, Dr. Ameyo Stella Adadevoh. However, we understood that, despite the loss and despite the pain that we felt, we understood what she stood for, her own core values of, really serving humanity, serving her patients, her dedication to her work, and her love for what she did for medicine. She practiced endocrinology, and she treated so many different people of different generations. There's so many families I can count that she treated the great-grandparents, the grandparents, the parents, and the children, and sometimes even the grandchildren. And she had a connection with all of them, despite the big age gaps. She was so dedicated that she would always be on call no matter what, and show up for her patients, whether that's at their house or at the hospital. And she treated everybody very equally. Obviously, she had some patients who couldn't afford the medication sometimes, and she would take that on herself where she could. And that just really spoke to her dedication and love for humanity, and trying to really help everybody that she came across where she could.
She was the kind of doctor who followed up with her patients. She was very close to them. Anytime she refers them, she would come down to the office in the corridor, that's at Thompson Avenue, to come say, "Oh, how is my patient doing? What are you guys doing? What's up?" and all that. So that was one thing that really struck me with her back then.
She was my mother's older sister. She was my auntie. We were very, very close, and losing her was one of the hardest things I've experienced. The way that she died was tragic. It was preventable. And so for me personally, it was that loss that made me realize that we needed to do something bigger than us as a family.
My mother, Dr. Adadevoh, instilled a lot of values in me. Faith, first of all, hard work, service for others, love. And those are some of the values that we carried into the DRASA Health Trust.
The need to preserve Dr. Ameyo's legacy and values, as well as a national impact from her selfless sacrifice. That is what birthed DRASA.
We sat around one day just brainstorming, thinking about what could this be, what should it look like. She dedicated her life to Nigerians, to caring for Nigerians, and we wanted that legacy to continue. So some people said we should name the hospital after her or build a new hospital. But for us, that wasn't going to have the sustainable impact and the reach that we wanted. And so we needed to establish something that was going to become an institution. We had experienced a lot of gaps in the system, a lot of challenges firsthand through the Ebola crisis. Nigeria did well, but there were things we could have done better. And so for us, it became imperative to not walk away from the situation, but to think of how we could partner with government, how we could come together to collaborate, to address some of those gaps that we had seen, to take on some of those challenges, and to try and strengthen the system to prevent these kind of things from happening in the future.
And so DRASA was really set up to prepare our health systems to be ready for any such threats in the future.
When we started DRASA, we didn't really know what direction we wanted to go in. So we took our time. Before we started raising money or implementing any programs, we sat down to do our research and understand exactly what would be the most effective use of our expertise and our efforts. It was so important to us that we would build something that was filling a gap, something that was meeting needs, not just because, oh, someone died and we've decided to try and preserve the legacy. We wanted it to be meaningful, we wanted it to be impactful, and we wanted it to be sustainable. And so for us, we had to take some time to strategize and decide, what does that look like?
The early days of DRASA were, inspiring. Despite still being in a difficult period, it brought our family together, and we decided on the mission and the vision, as well as what the team could look like to execute this mission and vision.
Ultimately, our vision was to impact the rates of disease through public awareness, capacity building for health personnel, and policy engagement with government.
Of course, it was not easy to put that together and to conceptualize how big it could become. We had a very, very big vision, a big idea. And it's not always easy to start with very small, right? When you have this big vision and idea. In the meantime, there were more lower hanging fruits where we could make direct impact.
Even though our model has evolved over the years, we've stayed true to our original vision. We're working from a top-down and bottom-up approach. And this grassroots to government model that we're implementing is really about ensuring that our impact is felt at both the most local levels as well as the highest levels of authority and decision making.
The early days was also hard to separate the human being that we were honoring and also the work we were trying to do. But we were able to do that through a very strong board, setting up a very strong governance structure.
From the onset, we wanted to establish a sustainable organization with good corporate governance, as well as bringing individuals who we felt could add significant value.
And so we were able to set up a very strong board, a board of governance, as well as an advisory board. And on the advisory board, we had healthcare professionals and medical professionals who had operated in Nigeria and internationally, and who also understood the concept of what we were trying to achieve. And then on the board of governance, we had very senior professionals from the finance world, the legal world, in business, and who could bring together the whole vision and ensure that the board from day one was going to be very valuable to the organization. I think without the board of trustees, DRASA would not be where it is today.
We partnered initially with the Penn University on developing simulation centers, putting together curriculums for training our human resource and nurses here in Nigeria and other parts of Africa in the future. So it was important for us to have this type of technical support from a well-renowned university in the US.
In terms of the team, we never envisioned how quickly we could put a team together and who the right person could be. But fortunately, Mrs. Niniola Williams, who was already working in the public health space at the time in the US, also a family member, my mother's niece, my first cousin, was just the right person for this role.
I already had a career in public health, and so it was a natural transition for me to move from what I was doing at the time to come and start something and establish something that would continue her legacy beyond Ebola. She was much more than that.
Initially, it wasn't an idea that just came to mind or a solution that just came. But with time, it was very clear that she was the right person, and she has, in every single way, lived and envisioned and exactly what we were trying to achieve. And she has taken it far beyond anything that we could have imagined.
The early days of DRASA were hard. We had a lot of goodwill in the very beginning because of my aunt, her name, and what she did. But over time, People began to forget, move on to other issues, and it became challenging to get people to align with our vision and our cause. We, in the very early days, had limited funding. We had limited results to show. And so we had a lot of rejections, a lot of no's, a lot of closed doors. But we persevered. We kept moving. We kept the passion going, knowing that what we were building was beyond and bigger than us. And so we didn't let those challenges stop us. But it was hard. There were some days when it was a question of, do we keep going like this? Or do we just align with what everyone else in the public health space is doing and become one of the many? But now, looking back 10 years later, I'm so happy that we stuck to our original vision and our mission, because that is what has brought us to where we are today. In the early days, we had few staff. We had a lot of volunteers, a lot of people who dedicated their time and expertise to us, but our core team was small. And with that small team, we were really a strong engine, building the foundation of what was to come.
I was the first employee, rather, of DRASA, outside of Ms. Williams. It was just her when I joined, and I was hired to help set a foundation for the research and evaluation that we were looking to do with DRASA. And so, yeah, it was definitely bare bones then. It was just two of us for a while. But yeah, we pretty much did what we needed to do, when we needed to do it. So we were for everything and all things. So as program coordinator, that was my job position title, and me, that was managing director, but then we just did everything that needed to be done. So yeah.
We were wearing many hats. Those of us in the team were managing many things: the program implementation, communications and marketing, fundraising. We had some core functions that were outsourced, but a lot of the work was done by that initial core team. And it was challenging because it was not easy to balance the various priorities that go into establishing something like DRASA. The institution was new. We needed recognition, we needed media publicity, we needed expertise and strong hands to guide us in our implementation. And there were times when we had to look for volunteers to fill in some of the gaps that we had as a team.
What kept me going in those early days when I joined DRASA, I think it's the opportunity, right? It's the opportunity to learn and grow. It's the opportunity to, really expand my, my capacity in terms of public health. Having to, dive into learning about, global health security as a whole. Looking at antimicrobial resistance and looking at infection prevention and control. I think that opportunity is what really kept me going. For someone coming from the background where you've been mostly involved in a particular infectious disease response. In this case, I mean HIV and AIDS. But coming to DRASA, I looked at that opportunity, and it just makes me feel like I have a potential, to do greater work and make more impact in the lives of people.
We're committed to a cause. We're not just doing work because we're doing work, but because we had a vision, we had a mission, we had a goal that we needed to achieve.
The leadership style of the MD was quite incredible, really incredible. It was inspiring. To a large extent, it made me I wanted to do more, because I could see that she was doing a lot on her own, and I was inspired to also say that, yeah, I should be able to do more and contribute to this good thing that we're doing here.
My first day at DRASA was April 23, 2018, which was exactly 1 week after I graduated from vet school. And I'm so grateful for that opportunity, for the chance that they took on me, and that has helped me to step onto different global stages in the global health and also public health spaces.
We were a small team that had really big dreams. Myself, Praise, Dr. Loretta, Ayomikun, Chris, Nonso, Rogba, Judith. We were small in number, but we had a lot to prove. And for us, it was so important that we continued to work alongside and learn from the people that we were supporting in the communities, in the schools, in the health facilities. We wanted to be able to prove that what we believed and the model we were seeking to scale had the impact that we believed it would. So we put in a lot of work, many times with not enough resources. We had to do a lot with very little, and we were successful. It was hard, we were determined, we had a lot of late nights, a lot of brainstorming sessions, a lot of failures, a lot of times when we had to step back and say, how can we do this better? What do we need to change? We didn't always get it right. There were times when we had to be humble enough to step back and reimagine the solution that we thought was right. And that was part of our growth.
It's almost a miracle to have a small team achieving great things. So it's a lot of energy, but with every dollar, we're able to stretch our dollar to actually make a massive impact. So you can imagine if we get a little bit more, we will just reach a lot more.
A time where I really saw the outsized impact of DRASA, being a small organization, was how instrumental DRASA was in formulating the national response to infectious diseases, which were implemented across borders of Nigeria, across the land borders, across the sea borders, and across the air borders at the airports. DRASA was training staff at the different border points on how to identify an infectious disease possibly coming over the border and how to contain it.
What the partnership with DRASA actually helped us, in the sense that fortunately it was the time of COVID. And so partnering with DRASA actually really helped in terms of trainings on infection prevention control, personal hygiene practices, waste management, and some other things. There was this person that came to the port at Tinkan. So we just went on board, just as a normal routine, went on board. So we were on board when the officer in charge called us that...
It's looking like we might do part 2 of this short film later on. But I think the story is phenomenal. I think we should give another round of applause. And again, congratulations to Nini and the team. Before the end of the day, we would have the rest of the documentary that continues to tell the story of the work that has been done. Well, ladies and gentlemen, we are going to move over to our keynote address now, and it's a real delight that we have a representative of the Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, who unfortunately can't be here. He actually did everything possible to make it, but due to some circumstance, he can't be here physically. Professor Ali Pate was right there at the beginning of DRASA Health Trust. So not just for me and for a lot of people here, for him also it's a full circle moment. I saw a note where it said that he has continued to champion a collaboration between government and trusted partners like DRASA. And in the early days, he was a real supporter and believer in the vision for DRASA Health Trust, and did a lot of hand-holding for Nini and the team as well. So can we just celebrate Professor Mohammed Ali Pate? Even though he's not here, the applause will echo and get to him. But we are also particularly delighted to have Dr. Nse Akpan, who is the Director of Port Health. And you can see that a lot of what DRASA does is help the port health officers. So we want to thank Dr. Nse Akpan for coming to represent the minister. We're going to invite him to do the minister's keynote address. Can we put our hands together?
Let me start by thanking the organizer of this event and also the MC. I will say we are so delighted when the minister received this information. He was so worried that he couldn't make it. honestly is unavoidably absent. It's another official engagement. That is why the ministries do everything necessary under its administration to ensure that we are fully involved in these events. I want to recognize the director of DRASA, Mrs. Nidola Williams, and my former minister, who is here present, very erudite professor, a man well vested with the experience of managing infectious disease. In fact, at a point, when some of us was in Port Health, we used to tag him as Professor of Emergency Preparedness and Response, because he was very, very active when it comes to issues of infectious disease management as at then. I'm talking about no other persons than Professor Yebuchi that is here with us. Prof, you are welcome. Some of us was his foot soldiers then, and when it strikes, we did not sleep. Neither did he himself sleep, so he has to push all of us to work as at that time. Thank you that we achieved success then. What a coincidence. When he left, another specialist on infectious disease also came in, which is Professor Pate. So the job became very easier, and we have to continue. I've been listening to the documentary that we just received now, and I asked myself a question. So many Nigerians, like the likes of Prof, the director of DRASA, and many others, they have contributed to sustaining or achieving a sustainable health in Nigeria. What have I done so far? It's high time we should start thinking of contributing to ensure that we have a universal health coverage, a sustainable, improve in public health practices in this country. If we do, then we had a long way to go by saying we have achieved success and we have made a remarkable improvement in this country. A lot of challenges we are facing in public health in this country is something that we don't need to sit back and ask government, what are they doing? It is time the youth, the women, men, everybody should rise to the occasion. We need to stop the outbreak of infectious disease in Nigeria, starting from cholera to every other one. And it's not only being mitigating or caused by animal factor alone, the human factor is there. Even when the president of this country, the former president, signed into law, the issue of open defecation and indiscriminate waste management is still ongoing in the country. So we have a role to play to ensure that the outbreak of infectious disease and every other disease in this country is being contained. The challenge, the ball is in our court, so we have a role to do. I will take up the minister's speech, but I want to stand on the established existing protocol. If I may not mention you or recognize you personally, I crave your indulgence. I believe I want to recognize everybody now. Bear with me if I don't know your name or mention you one by one. And I was told, speak and stop where the ministers speak. I'm a civil servant and I will not want to trespass. My prof is here, is watching me. If I dare make that mistake, bear with me, sir. I believe you will not sanction me. Ladies and gentlemen, I will start by taking up his speech, and I want to say that the entire ministry, even with the demise of Dr. Adadevoh, we are still watching her within ourselves. Can we be like her? During Ebola outbreak, I was there. I was involved. But somebody did a fantastic job. And today, we live to remember her. Will you be remembered in this situation? So it is a privilege and honor to join you today at the 10th anniversary celebration of Dr. Ameyo Stella Adadevoh, which started as DRASA Health Trust. 10 years ago, Nigeria faced a terrifying threat of the Ebola virus. We remember with profound respect Dr. Ameyo Stella Adadevoh, whose courageous and decisive action protect millions of Nigerians. Her sacrifice embodies the highest ideal of medical professionalism and national service. Today, through DRASA work, her legacy lives on as a living movement for disease prevention and health security. I also honor the countless health workers, including doctors, nurses, laboratory staff, port health officers, and community volunteers who have risked their life in outbreak of Ebola, down to COVID-19 that we had a few years ago. They continue to serve us daily in our hospital, clinics, border posts, and communities. Today, this gathering reminds us that prevention is the cornerstone of a resilient health system. Too often, the world waits for a crisis before investing in preparedness. So most times, you see us waiting for when it strikes before we start getting up to prepared. It is time now that we need to prepare and get ready because it can strike anytime. Yet the lesson of Ebola and COVID-19 are clear. Every naira spent on infection prevention, hygiene, and antimicrobial resistant control save many more in treatment and economic loss. The rising threat of drug-resistant infection is a silent pandemic. If we fail to act now by investing in strengthening infection control in hospitals, promoting responsible use of antibiotics in communities, and embedding hygiene practice in school, then we risk undermining the very foundation of modern medicine. Through DRASA support to the government in developing and launching Nigeria's second One Health AMR National Action Plan, and their work training nearly over 16,000 health workers in infection prevention and control, we see what is possible when prevention is prioritized. So prevention, like we rightly said, is better than cure. Are we working toward direction? Our Ministry's National Health Sector Renewal Investment Initiative and the sector-wide approach reflect our determination to move from fragmented effort to a unified, efficient health sector that saves life and delivers values for every resources invested. Therefore, we are working to strengthen primary health care and ensure equitable access to essential services. We are also working to expand and retain the health workforce, particularly in underserved areas. Equally, we are also working to scale up emergency preparedness and response through community-based surveillance and rapid response team. We also work to ensure that we promote local production of essential medicines, commodities, and reduce dependence on imports. And that's what the government of the day is trying to ensure, that the cost of importation of drugs is becoming so much. So we are working toward ensuring that we dwell on our local productions. Our pharmacies are there, the raw materials are here. It's time we should start thinking inward. If you look at it, the donor dependence is becoming something that we are, recreating today. The government has started working toward ensuring that with our limited resources, we can also meet up and ensure we improve our services in the health sector. For much of the past decade, DRASA has worked with us in this part, side by side with the government, helping us to achieve our mandate in disease prevention, strengthening infection control system, and providing technical expertise that align closely with both national and state level priorities. DRASA's council to government approach, evidenced by how they have mobilized nearly 100,000 health champions. When that man was saying about 95, we look at it that it was even more than 95. It's almost 100,000 champions. And they have done this both in community schools, health facilities, government institutions, and how they have supported policies like the National Patient Safety and Care Quality Strategy. They also fit squarely within the National Reform Agenda. So we want to appreciate DRASA for a nice job they have done and their contribution toward development and improvement in health sector. DRASA roles and contribution in key technical platforms such as the SWAP program, under the Health Security and Technical Working Group, and the National AMR and IPC committees are strengthening the partnership between government and civil societies and demonstrating the result of such collaboration. Today, we are also calling on private sector more to join in ensuring that we move the health sector to the next level. In our work together, which ranges from shaping national AMR and IPC's policies to building public health capacity at borders and in hospitals, DRASA has proven to be a trusted and expert partners of the government, ensuring that interventions are not parallel or fragmented, but woven into our national health system. For this steadfast collaboration, we express our appreciations. However, health security is not the work of the Ministry of Health alone. It demands the activity of participation of other government sectors from finance, environment, and education. That is why we are working under another platform called One Health. So we intend to integrate the programs that what affects health, most times the environment is affected, the livestock is affected, and education is also affected. So we need to integrate, and we come up with one umbrella called One Health. We also need to ensure that private sector, like I already mentioned, also partake because they can drive innovation and sustainable financing. Also, development partners, we need to bridge the technical and catalytic support that we have faced. They are still with us. We equally need the communities and youth because tomorrow they are the champions. We need to embrace daily disease prevention and are often the first to detect and respond to emerging health challenges. They are there in the community, and when most of this disease strikes is in the community, we need the youth and we need community participation. So if you happen to be one, be sure you have a lot to contribute toward disease detection, preventions in the communities. DRASA stories illustrate this truth. Whether equipping border officials, engaging artisans and market women as health champions, or supporting young people to shape antimicrobial resistant policy, DRASA has shown a whole of society approach is essential. Our drive to renew Nigeria's health sector must reflect these voices, the voice of communities, the voice of youth, and the marginalized group. Policies designed in Abuja would not succeed unless they resonate in the communities, in the marketplace, in the farm, in the school, in the churches, in the mosques, and clinics. That is where the policy will work. If we sit down here and say, we have a lot of health policies, and we are not moving to the grassroots and test on these policies, then it therefore means we have not done anything. So that is what we are doing, and we know that DRASA has been supporting this Minister of Health a lot in this direction. When a roadside mechanic in Lagos leads his peer to adopt better hygiene practices, or a young student in Osun State educate our classmate on hand washing and proper antibiotics use, we see health security at its most powerful when it is owned and driven by our citizens. Don't forget, 80% or if not all of us practice public health, and we can achieve this if, just like I said, when the commoners, when all citizens of these countries knows the importance and values of ensuring that we need to have a better health in the country. This is why inclusion is central to our SWAP program. It is not only about being fair, it's about being effective. Ladies and gentlemen, the health and prosperity of our nation cannot rest on the shoulder of health workers alone. It requires policymakers who prioritize prevention, business leaders who invest in local solutions. It also requires the effort of the media that amplifies accurate information, community influencers who inspire trust, and youth leaders who demand accountability. I will celebrate DRASA today, which is the first decade, and look to the future as a plan to establish an academy, scale infection control, training to about 50,000 health workers, and embed AMR education in every secondary school. I urge all stakeholders to join and strengthen the collaboration. So we need to join DRASA to ensure that we achieve their mandate and their planned program in the nearest future. Let us commit today to close coordination under the SWAP framework, aligning our investment and scaling in inclusive intervention that make the health system more resilient to both present and future threats. Today, I congratulate the DRASA Health Trust and its boards, dealership, partners, especially its networks of health champions on a decade of education and impact. Together, you all have turned the sacrifice of one extraordinary woman into a nationwide movement for prevention and resilience. As we enter the next decade together, let us hold fast to this simple truth. Health security is everyone's business. So we have a task. If health security is everyone's business. It wasn't the business of Dr. Adadevoh alone. It was also the business of all of us. It wasn't the business of Dr. Nyemeji alone. It was the business of all of us. So we need to be prepared because we don't know when we are going to face any other outbreak or any public health threat, any public health emergency. We are not praying for, but it's something that it can happen. And when it happens, I hope we are all prepared. And if we do so, it therefore means that we are ensuring that at the end of the day, we will have a sustainable and effective universal health coverage in Nigeria. Thank you so much. Thank you, and God bless you all. God bless the Federal Republic of Nigeria.
Ladies and gentlemen, one more time for Dr. Nse Akpan, Director of Port Health at the Federal Ministry of Health and Social Welfare, representing the Honorable Coordinating Minister of the Federal Ministry of Health and Social Welfare, Professor Mohammed Ali Pate. Thank you so much, sir, for that call for personal recommitment. That's what you started with. A call for all of us to personally recommit to universal health coverage and improvement in public health practice in Nigeria. And right now, we would just like to usher in and welcome the Chief of Staff to the President of the Federal Republic of Nigeria. Ladies and gentlemen, we're delighted to have with us the Right Honorable Femi Gbajabiamila, CFR. You're very welcome, sir. All right. In the minister's welcome keynote, he also talked about how we all need to rise to the occasion, how this is a call for everyone. Health security is everyone's business, is how he ended this. And he also thanked and acknowledged DRASA Health Trust for all the work they've done. So I wasn't wrong when I rounded the figure up to 100,000 because the minister also did that. So one more time, can we just celebrate DRASA Health Trust? Thank you. We are going to play you another video. We have testimonials of certain individuals who have been part of the story with DRASA Health Trust. And so we want to have those testimonials now that tell us some more about the journey from the perspective of people who have worked very closely with the organization. Right after this lightning, we're calling it lightning testimonials. Right after this, we're going to have the Managing Director of DRASA Trust make her remark.
I bring you greetings from the World Health Organization and have fond memories of my time as Director General of the Nigeria Center for Disease Control, where I work closely with the DRASA Health Trust. Today, I am honored to celebrate the 10th anniversary of DRASA Health Trust, not only as an organization founded in the memory of extraordinary service, but as a living institution that works to strengthen Nigeria's health security every single day. We all remember the courage and conviction of Dr. Ameyo Stella Adadevoh in 2014. Her swift action and unwavering principles supported the containment of Ebola in 2014 and saved countless of lives in Nigeria. DRASA has transformed that legacy of sacrifice into a sustained movement for prevention, preparedness, and community engagement, linking the grassroots to government and turning lessons from crisis into lasting systems. That is the quiet, essential work that keeps hospitals safer, communities informed, and outbreaks contained. During my time leading the NCDC, I learned that preparedness is not a project, it's a culture. It grows from consistent partnerships and daily practice. DRASA has been one of the most steadfast partners to the Nigerian people in this regard. Together, we invested in the foundations that matter most: infection prevention and control, and the disciplined use of data to strengthen decision-making and learning from our frontline health workers. Today, I speak wearing a different hat. In my current role at WHO, I work with colleagues around the world to prepare for and respond to health emergencies. Yet, what we do globally only matters when strong national institutions and trusted local partners turn strategy into action. The true test of global health lies in primary health centers, schools, and communities. And these are precisely the places where DRASA has focused its energy for a decade. I continue to support and endorse DRASA's work because I have seen its value firsthand. Partners like DRASA fill critical gaps, amplify essential messages, and do the patient, often unseen work of training, mentoring, and strengthening Nigeria's health system from within. This is what true partnership looks like. As DRASA enters its next decade, it does so with an ambitious and necessary vision. If we are serious about building stronger, safer health systems in Nigeria, we must continue to invest in and power local institutions like DRASA, those that work quietly between emergencies to keep all of us safe. 10 years on, the best way to honor Dr. Adadevoh is not only to remember her courage, but to embed the same bold spirit in the work we do, in every facility, in every team, and in every community. Congratulations, especially to my dear sister Niniola Williams, and your team at DRASA, your partners, and everyone who has contributed to this journey. I wish you continued success as you build for the next decade, sustained prevention, safer care, and healthier communities. Happy anniversary.
Dr. Ameyo Stella Adadevoh Health Trust, DRASA, was born out of courage. It is the legacy of Dr. Ameyo Stella Adadevoh, who stood in the gap, paid the ultimate price, and saved millions of lives. Her sacrifice was one of the greatest acts of national service. Hence, DRASA was established in her memory. I knew Ameyo personally as a classmate and as a friend. She always stood firm for what she believed in. Years later, during the Ebola outbreak, I saw her courage firsthand on the front line while I served as the Commissioner for Health in Lagos State. 10 years on, DRASA carries a vision forward, preventing infections, protecting health, and strengthening systems. Its impact has been clear in hospitals, schools, and communities across Nigeria. DRASA has worked with NCDC and African CDC to train health workers. It has worked with the UNDP and the European Union to strengthen pandemic preparedness and response, and with the WHO to expand youth health clubs. with Lagos State government to build frontline capacity, and with the private partners like Unilever, Ikeja Electric, and CleanMate to take hygiene and campaigns to schools and communities. These collaborations have multiplied DRASA's reach and impact. At NCDC, we see DRASA not only as a partner, but as a true collaborator. Collaboration has been the key to our success together, and it remains central to what we achieve in the future. As DRASA turns 10, my reflection is one of deep respect and inspiration. May it continue to grow as a beacon of courage, innovation, and excellence. And may Ameyo's sacrifice always inspire us all to collaborate for the health and safety of our people. Happy anniversary, DRASA.
I was the provost of the College of Medicine. DRASA came to the college for us to have an MOU. And that's how I connected with DRASA. And I think since then, we haven't disconnected. If anything, the bonds have gotten tighter. DRASA is a purposeful, value-driven NGO that works to improve the health of Nigerians. And I use the word purposeful and value-driven because they are ethical, all values. They're courageous. They go sometimes to places where others are not thinking. They're strategic about it. They have heart. You know, it's not just professionalism, but you can feel that a lot of things they're doing because they can actually feel for the people. And I find that DRASA has strategic partnerships. Anything that would advance that cause, DRASA is ready to work with them. And that has been something I have noticed across the way. People should join DRASA because this mission that they're on, frankly, is what we need to ensure that there is health care for all. Of course, DRASA is not the only group doing this, but DRASA is doing it certainly very well. And the lessons we learn from DRASA is that you don't have to have a lot to start, and that with the right attitude and the excellence and organization, you will get things done. There's something unobtrusive about DRASA, but the impact is great. And we need more people doing that. And then you get a sense that ego is not involved in this. It's really about what can we achieve. And because you don't have all the ego of territorialism, they will work with anybody that would achieve. And they're ready to add value, even if it's not necessarily for their own benefit at that point in time. But I would say they have a big sense of patriotism because they can see that everything that they do is how good is it for Nigeria. So even if it's not for their immediate gain, they jump in and do it as though it's their particular motion. You know, so when you have those kind of organizations, you treasure them. And so the DRASA story, I wish more organizations had that. So those who are still in the wings, I think if we jump on board with DRASA, we will get further in Nigeria in 5 to 10 years. I hope to see DRASA as a much bigger organization that in itself can catalyze smaller organizations and other organizations to take up its course, and also taking this course into Africa. I plan to keep DRASA close for a very long time. I think it's a great organization. I think they're doing something right that others can emulate. So whatever you're doing is working. Just do it better. So DRASA, I wish you a happy 10th anniversary. And I hope that I'll still be here in 10 years' time to wish you a happy 20th anniversary. I know you'll still be around. So have a fantastic 10th anniversary and keep on impacting Nigeria.
I was drawn to support DRASA when I heard the founding story for the very first time a few years back. And then thereafter, I got an opportunity to meet Niniola where I learned more about the work that DRASA is doing and what she and the team envision for healthcare in Nigeria. What stood out to me was this idea of, bringing together changes at the policy level, but also working at the grassroots level with community health champions. And I really liked that it was a solution or an intervention that was really going to go the distance based on how everything had been designed. DRASA's vision is important, and more importantly also how the work is done, because this idea of championing healthcare and really starting at a preventive level makes a lot of sense, and I think that prevention is essential when it comes to alleviating, the pressure on our health systems and infrastructure across the continent. And overall, this will lead to better health and livelihood outcomes across the board. Others should come on this journey and support DRASA for the next decade to come and beyond, because DRASA have a very clear plan, and a direction for the change that they're working towards. And all of that, and I think it's very clear, this idea around the grassroots engagement, the government partnerships, all towards building, long-term systemic change in the healthcare space. DRASA's work matters, not just for Nigeria, but for the continent of Africa and for the world at large. And I really am a proponent that preventive healthcare is absolutely essential when it comes to alleviating pressure, the pressure that our health systems, especially on the African continent, and our health infrastructure really deals with. So I feel like if we can figure out prevention, on the other side of that, it will lead to better health and livelihood outcomes for all. Congratulations, DRASA, on your incredible decade. My name is Joy, and I just want to say happy 10th anniversary, DRASA. Well done.
African Collaborative has been supporting DRASA since 2023. I first heard about DRASA during the announcement of our cohort 3 partners. This was in 2023, and it was just shortly after I joined African Collaborative. And the name caught my attention because DRASA sounds similar to DARASA in Kiswahili, which means classroom. So I was very curious to learn more about DRASA, so I went through the application documents, and we also had a follow-up call with Niniola just to understand DRASA's 2023 annual plans. And what stood out for me was Niniola's passion in describing the work. I remember she spoke about the partnerships and the collaborations that they've had with the government, especially during COVID-19. And this was very interesting because I got to learn how DRASA's model works and how they did a great job in raising awareness during COVID-19 and also promoted preventative practices to the community. We support DRASA because DRASA is equipping people and systems to stop infectious diseases before they spread, and this leads to saving lives and strengthening health security. I was especially proud when the DRASA was recognized by the Skoll Foundation as a leading African innovator, making healthcare accessible and reliable. This really validated their model and also honored the legacy of Dr. Adadevoh. In 2024, my colleagues and I visited DRASA for a site visit, and this was an amazing experience because we got to meet the team, we got to meet different stakeholders that DRASA works with, and also we got to meet community health workers and the students that DRASA has trained. The students who we interacted with demonstrated deep knowledge about infectious diseases, and they also mentioned that they were applying these at home. And they kept mentioning that the community health workers have really been helpful in just sharing with them knowledge that they've been able to apply at home. I remember there was one student who shared a story that after learning about antimicrobial resistance, she was able to convince her family to stop self-medicating. And so right now they seek proper medical care. I think it's important for others to join in supporting DRASA's cause because communicable diseases remain a leading cause of death, especially among children in rural areas. And many countries lack proper preparedness despite frequent outbreaks that we experience within our communities. So supporting DRASA will mean addressing these urgent gaps, saving lives, and also building healthier and safer communities. My name is Julie Hamati. I'm the Senior Coordinator, Portfolio Services and Special Projects at African Collaborative, and I would love to wish DRASA a happy 10th anniversary. I wish you all the best in this journey, and we are here to support you. All the best.
Yes, yes, that round of applause can be loud, ladies and gentlemen. Come on. Now, those were institutional voices, partners, friends, and you just heard from Ms. Julie Kamathi, who are a founder of DRASA. And I like that right there, she wrapped up. She said, please support DRASA to continue to plug these gaps. And at some point today, you're going to get some more information about how you can be a part of the journey. So please look to your neighbor and say, you are part of the journey. You are part of the story. Now clap for yourself. Now, not only are you a part of the journey, your checkbook. Okay, we'll get to that. Your checkbook and your cards are also a part of the journey. And I'm sure that you're here because you've already made that commitment. So thank you, thank you, thank you. In that video, we saw Dr. Chikwe Ihe Kwazu, who's an executive director at the World Health Organization, but he used to be the DG of NCDC and was a real partner and supporter for DRASA Health Trust. We had Dr. Jide Idris, who is the DG of NCDC, and we're still expecting him. We had Professor Folashade Ogunshola of Unilag, and Miss Joy Kikandi, who you saw on the video, is here present, and she came all the way from Kenya. Can we celebrate Joy Kikandi? And so DRASA's network and connections stretch across the continent, and of course we had Miss Julie Kamathi as well. Ladies and gentlemen, in the room, we recognized earlier the Chief of Staff to the President of the Federal Republic of Nigeria, Right Honorable Femi Gbajabiamila. I want to welcome and thank him one more time. Can we just put our hands together and thank him for coming and bringing the weight of the presidency behind today's occasion. Would also like to specially greet the Mandate Secretary, Women Affairs at the FCT Administration, Dr. Adedayo Benjamin Zelani. You're very welcome, madam. We also have with us Dr. Olufemi Ogunyemi, who's the Managing Director and CEO of the Nigeria Export Processing Zones Authority. You're very welcome, sir. And another partner, very dear supporter and friend of the house, and in many ways, a family as well, Mr. Larry Gbajabiamila. You're very welcome, sir. Allow me to do this. Even though we recognized him earlier, he came right on time. A lot of us who couldn't be here on time because of traffic, we understand, so we're not shading you. But somehow, I don't know if he found a helicopter or he was able to teleport. I don't know how he got it, how he managed it. But he's someone who's paid rapt attention, and we're going to hear from him at some point. But I just thought to recognize him one more time, a former Minister of Health, Professor Onyebuchi Chukwu. We greet you and welcome you again, sir. Thank you so much. All right, without further ado, ladies and gentlemen, we've recognized her, we've thanked her. We are all very huge fans of her. She is the force driving DRASA Trust, DRASA Health Trust. The Managing Director, DRASA Health Trust, Mrs. Niniola Williams. Ladies and gentlemen, come on, make some noise.
Oh, wow. Good morning, good afternoon, and welcome to everybody. Whether you're joining us online or you're physically present, welcome to DRASA at 10. I'll start by saying that I would like to observe all protocols. The Right Honorable Femi Gbajabiamila, Chief of Staff to the President of Nigeria, the Honorable Coordinating Minister of Health and Social Welfare, ably represented by Dr. Nse Akpan, Director of Port Health Services, the former Minister of Health, Professor Onyebuchi Chukwu, Director General of the Nigeria Center for Disease Control, the Chief Veterinary Officer of Nigeria, Directors of federal and state agencies, representatives of our federal and state governments, our funding and technical partners, distinguished members of the diplomatic community and development partners, leaders of business and philanthropy, our board of trustees, our board of advisors, and the DRASA team, both past and present, our community health champions and youth leaders, our volunteers and members of the media, friends and family. Thank you all so much for honoring us at this milestone moment. I want to begin by acknowledging today's date. Today is October 20th, and we may not realize that it's actually a date that is etched in Nigeria's health history. It was 11 years ago exactly today that the World Health Organization declared Nigeria Ebola-free. And a year after that, we launched DRASA. So that is why we are here today, again, on the 20th of October, to celebrate, to reflect, and to look ahead to where we are going. So people often ask me, where did DRASA come from? Every story has a beginning, right? And ours began with a phone call. Her voice was calm, but sober. I think I have a patient with Ebola. Don't tell anyone. That was my beloved aunt, Dr. Ameyo Stella Adadevoh. In July 2014, during a moment of fear and uncertainty, she made a decision that turned into what was now support for the greater public good. Her decision protected Nigeria and the world from what could have been a major public health disaster, but it cost her life. She stood firm to protect Nigeria, refusing to let an infected traveler leave her hospital, despite the risk. That legacy is the seed from which DRASA was grown. That season was by far the worst thing that happened to my family. In the midst of the storm and the confusion and the fear, we actually saw something very powerful, which was that we had relatives, we had friends, we had colleagues, we had even strangers rallying around us. We sourced experimental Ebola medications from the US and Canada. We arranged for private medical air transport to move her and some of the other patients. We identified rehab facilities for the recovery process post-Ebola. We all came together to do everything we could to try and save her life, and the lives of the others who were also infected at the time. Within days, we found that we had mobilized the best medicine, the best expertise, international transportation, and so much more, within days. But it was still too late because we couldn't save her. What we learned was that when we come together, there's almost nothing that we can't achieve. At the time, I was building a career in public health in Washington, DC, and the organization I was working with, we were already responding to Ebola in the 3 West African affected countries, Guinea, Liberia, and Sierra Leone. So I knew exactly what the virus was doing in the region. But suddenly that work became personal because she was involved. So when we decided that we couldn't let her death be in vain, it became clear that I had to come home and do something. So DRASA was born, and it was born as a promise to her legacy. So as I stand here 10 years later, I'm so proud to say that with all of our partners and with all of the support we've gotten over the last decade, we've been able to do that. It has been a journey. When we started, we had a very simple belief that prevention was powerful and that communities were capable, that Nigeria could build a health system that keeps people safe every single day, not just during outbreaks or emergencies. So we set out to strengthen the system, raise a generation of health champions, and make everyday disease prevention the norm. But in the early days, it was hard because we had no brand recognition, we had no major big donor, we had no shiny success story or results to share. We just had a conviction that disease prevention was the way to go. It needed to be systematically institutionalized in our schools, our communities, our hospitals. So we knocked on a lot of doors, a lot. Some doors opened because of her name and the memory of what she did, but others stayed shut. And I'll never forget, there was one private sector leader who, after waiting hours and hours to see him, he said, "So why should I care? It's like you're selling insurance for something that may never even happen." And that stung, but we realized that what we were trying to build was not just in case of the next Ebola. It was a model that would ensure that everybody gets safe and quality healthcare, free of the threat of everyday infections, not just the big headline-making infections like Ebola and Lassa fever. So we accepted the feedback, and we learned, we refined, and we knocked on the next door. In those days, we had a lot of face-to-face meetings and some Skype meetings, because then there was no Zoom, it was Skype. We were using Skype. We chased potential partners, we chased donors, and slowly we started building the relationships that have gotten us to where we are now, a decade of impact. And that's why this 10-year milestone matters. It's giving us a chance to pause and reflect and celebrate with each and every one of you who have played a role. So we have a lot to celebrate, a lot, because so much has happened. And DRASA, as you've seen, has become a trusted partner of the government, health workers, communities, the private sector, young people all over Nigeria, and we want to continue to build that. As you've also heard, some of the highlights of our work are training over 15,700 health workers. Why? So that they can deliver safe and quality healthcare every single day, not just in the face of emergencies. We've developed a network of over 96,000 health champions. And what do? They promote hygiene, they improve sanitation practices, they detect and report cases of infectious diseases in their schools, their homes, and their communities. We have 3 of them here today, and you will hear from them directly. We've established 13 public health response systems at Nigeria's largest airports, seaports, and land borders in 9 states. We've activated cross-border health forums between Nigeria and 2 neighboring countries, Benin and Niger, to ensure that information can be shared and we can have stronger response to public health issues across our borders. We've supported the development and implementation of 28 national and subnational public health policies. But the real proof of the impact for me is not the numbers, but the stories. And you'll hear a lot of them today. Hearing how one young health champion was given time during her Sunday morning church service to teach the congregation disease prevention is an example of how we are empowering the young to teach the older generation. Having a nurse in a government hospital come and tell us that truly before we came, she just thought that gloves were enough to do what needed to be done, protecting patients and herself. But now she understands that controlling infections is much bigger than wearing a pair of gloves. The fact that when COVID-19 hit, we were ready to train thousands of people overnight because we had been laying the foundation for years. So 10 years on, we have grown. We are no longer just a memorial or a tribute. We are building an organization that is a national institution shaping how Nigeria prevents disease and protects health. But we could not have done this without our village. A village of consistent supporters, volunteers, advisors, funders, our friends of DRASA, as we like to call you all. So on behalf of all of us at DRASA, I say a heartfelt thank you to everyone, individuals, organizations, all of you that have been parts of our journey. I give thanks to God because without him, we would not be here. I would not be here without the endless grace. Thank God for strength when we were tired, for ideas when we were stuck, for protection as we work in clinics and communities that are not the safest environments across Nigeria. For the people and partners that he sent our way, we are grateful. So what have we learned in these last 10 years? We've learned that the behaviors that prevent infections every single day also help us in emergencies. We've learned that antimicrobial resistance, which sounds like a very scientific word, is not a silent pandemic anymore. It's the #1 global public health threat we have, and it is here now in Nigeria. It will take all of us to change how we make sure we're using medications properly, cleaning our environments, and supporting the health system. And most of all, we have learned that if you want to go far, you go together, not alone. So as we reflect on the past, we also have to look forward and talk about where we're going, because there's a lot to be done. Our vision for the next decade is resilient clinics, reliable protocols, and empowered communities. So imagine this, a lady walks into a clinic and she's coughing. There's a trained health worker at the door. That person greets her, asks her all the right questions, guides her gently to a holding area. She is then transferred to a state-of-the-art isolation space where it's clean, it's well ventilated, and she's given dignified care. Though she's in isolation, she's not alone. She's being cared for by professionals who are trained, who know what they're doing. And after a few days, she returns home healthy and safe. Now let's go into the community outside that clinic. Imagine a local butcher, a local health champion, trained by DRASA, who is explaining safe meat handling and food safety practices to his neighbors in the market, dispelling rumors about disease and demonstrating how to practice hygiene with pride. Then now picture the corridors of power, as we like to say, where decisions are made. A youth representative from our youth network is seated at the table, advocating for policies that are data-driven, policies that reflect the voices of communities and the needs for the next generation. That's the Nigeria that we want to build together, where prevention is everyone's business and dignity is everyone's right. So for DRASA to reach that, these are our strategic plans for the next 10 years. The first, as you can see on your screen, is establishing the DRASA Academy. It's going to include a state-of-the-art simulation center and an edutainment hub where health messages meet culture and creativity. So imagine a nurse practicing how to treat a sick patient in a realistic simulated ward, as well as a butcher learning how to handle meat safely in a mock marketplace. Then you also have a youth health champion who's producing TikTok dramas and mini videos for social media to change behavior. With this academy, we will build skills and competence in the health champions that we are training today. We will train and certify 50,000 additional health workers in infection prevention and control. We will expand our health champions network to 500,000 people across schools, markets, faith institutions, and the borders that we work in. We will also establish centers of excellence across all 6 geopolitical zones. That's the DRASA Academy vision. Beyond that, we've started this, embedding hygiene, health, and antimicrobial resistance education in secondary schools across the country to raise prevention-minded citizens in the next generation. And finally, the third focus area for us going forward is youth. Embedding youth-led coalitions into national technical working groups, state governance structures, to strengthen youth participation and the use of community-level data in public health decision-making. We're formalizing these youth groups and their role in these policy dialogues already, so that the people who are going to eventually inherit the system can be the ones to also design it now. We will keep working from the grassroots to the government with our trademark, a blend of evidence and persistence. So 10 years ago, we turned grief into action. We now renew that promise to continue to honor our heroes by protecting the health of every Nigerian. To all of you in this room and to all of you watching online, government leaders, business captains, development partners, health professionals, community influencers, students, partners, whoever you are, we need you The next decade's victories will be collective. So as we unveil our endowment fund, as we watch the rest of our documentary video, as we step into our next chapter, I invite you to walk with us, invest in disease prevention, help us build a future where there's no courage of a health worker that is wasted and no community is left unprotected. Without DRASA's support, Nigeria will be a country that is more vulnerable to disease, to panic, and avoidable economic loss. We could see hospitals across the country lose their infection prevention and control specialists, who we train currently through our partners. They're keeping wards safe. They're making sure that patients are not afraid to visit the hospital, thinking that it could cost them their lives. We would see that our community health champions, the women, the teachers, the traders, the religious leaders, and the youth can no longer amplify health messaging. Without these trusted voices, misinformation would flood the vacuum, and everyday hygiene and disease prevention would break down. Outbreaks would last. Youth would no longer be able to teach their classmates, their family members, and neighbors how to stay safe. We would have antibiotics and antimicrobials traded openly in the open markets and within health facilities, fueling drug-resistant infections. So we want to work with each and every one of you to make sure that this does not become our reality. On behalf of the entire DRASA family, thank you, God bless you, and may God bless the Federal Republic of Nigeria. Happy 10th anniversary, DRASA.
Come on with that round of applause, come on. That round of applause is in honor of the Managing Director of DRASA Health Trust, but it's also to celebrate DRASA Health Trust family, the team. Yes, keep it coming, keep it coming. And to one more time celebrate the memory of Dr. Ameyo Stella Adadevoh herself. Thank you so much. You may have your seat. I would have read Nini's bio before she came up, but I just thought to bring her up quickly. But just so you know, that it's not just a family business where you just bring somebody. Some people might be wondering, okay, it's because she's a family member. No. Nini has a bachelor's degree in cognitive science and neuroscience from the University of Pennsylvania and a Master of Science in public health from the London School of Hygiene. Make me clap for him now. But she also has done some courses at the Pan-Atlantic University and the University of Lagos. And now the Vice Chancellor of the University of Lagos said something in her address that I think, Nini, you touched on as you spoke, or that you demonstrated as you spoke. She said that DRASA is not just about professionalism, it's about heart. And that the work that you guys do is not just significant because you're professionals, that she sees the heart behind what DRASA does. And then Nini in her speech just now said that it's not just about numbers. You know, impact and real proof of impact is not just in the numbers, but in the stories, in the individual stories and individual lives and communities that are transformed by the work of DRASA. And I think that's something really significant that we should celebrate one more time for DRASA Health Trust. A lot was said. A lot was said. I think for me, I want to highlight the fact that we are going to go far together and not alone. And for the next decade for DRASA, it's about all of us going together. And so to reestablish that fact, we are now going to do something very important. The vision for the next 10 years and beyond has been stated. It's about resilient clinics, reliable protocols, the DRASA Academy, and all those things. And to do all of that, what do we need? What is this? What is this? Tell your neighbor, tell your neighbor. Good, good. So we want to talk about funding and partnerships for the future. We want to unveil the endowment fund. And so I'm going to call up and just quickly introduce our DRASA Health Trust Partnerships Manager, Ogome Emebo, who will talk about this. Ogome Emebo is a public health and development professional with over 21 years of experience. She has worked in several organizations. Her enthusiasm for resource mobilization, grants management, and development projects has accrued portfolios with organizations such as the USAID PEPFAR, MBTS Demonstration Project, the Johns Hopkins University Public Health in Nigeria Initiative, many other projects. The list is almost endless. The Embassy of the People's Republic of China Bilateral Development Project, the Institute of Human Virology Nigeria Project, and that's just to mention a few. Now, as partnerships manager at DRASA Health Trust, she leads fundraising activities to expand DRASA's grant portfolio and coordinates partner relations and management functions. So her job today is to convince you to open your wallet. Ladies and gentlemen, please put your hands together as I welcome Ogome. Make some noise for Ogome. And I'm sure you won't need that much convincing because you believe that DRASA is already doing a fantastic job. Ogome, you're welcome.
Wow. Good afternoon, everyone, all over again. It's really pleasing and, joyful to be here today. You're all very good, by the way. Yeah, colorful. The first thing I'm going to do today is acknowledge the existing protocol here already established and to say a very big thank you to our local and international partners. And that's a very good place to clap, please. Yeah. Very good place to clap. Yeah. So we appreciate your commitment. We appreciate your consistency. We appreciate your concern. We appreciate everything you have done for DRASA. Every single contribution in kind and cash in several ways that has brought DRASA this far. We say a very big thank you to you all. Thank you very much. Yeah, thank you. Thank you. Thank you. So I have an assignment today. My assignment is very, very straightforward, but also very exciting. Why is my assignment exciting? It's because today marks an extremely historic and transformative moment in the Dr. Ameyo Adadevoh Health Trust's history. What we're about to do is a testament to DRASA's resilience, undauntedness, commitment, passion, and willingness to ensure that disease prevention continues in Nigeria. It goes unstopped. Our impact is expanded, and we protect health in Nigeria beyond this decade. We're going for this decade and beyond. So this is so transformative. It's a giant stride, and it is really, really a noble cause. Now, what I'm going to do is to give our participants online and those of you here real time to join the movement. I want to present an opportunity to you to demonstrate that concern, that love, and whatever made Dr. Adadevoh do what she did. We all understand. We have heard so much about her. We have heard so much about her values and everything she stood for. This is demonstration time. This is a time to show it, and this is a time for action. I'm going to do that by unveiling our endowment fund. But, we have an audience that is extremely exposed here. I know that the endowment fund is not a new terminology, right? But I just don't want to make assumptions. So I'm going to explain a little bit about an endowment fund. So in a nutshell, an endowment fund is an income-generating approach or model that will enable DRASA spend just a percentage of interest that is accrued from an initial principal investment that remains untouched. So that means that we're going to have a principal amount that will be managed by a professional certified investment manager. It will be kept untouched and will be invested, right, in different kinds of, we're not, those are things we're going to finalize. Securities, bonds, but basically investments. The returns on that investment, a percentage of it will be used to sustain DRASA's interventions for years and years and years to come. That's a very good place to clap to. Thank you. Thank you to that person. So what's the implication of this? The implication is the perpetuity, the long-term effects. It also means that we don't have to come back to you year after year to say, give to DRASA, we have this project, you know, we want to reach out to more health champions, we want to train health workers. No. Your annual giving becomes, or your one-time giving translates to annual impact over time. And the fund continues to go on. Why do we want to do that? We all know what has happened recently in the global donor landscape. I mean, these are really, really uncertain times. I'm sure we all agree. Yeah. The things we have to do are really capital-intensive projects. For instance, my MD has showed you that we're going to establish the DRASA Public Health Academy, where we're investing in health champions, building capacity of our health workers, making sure that both patients and health workers are in safe environments when they go to the hospital. And you know, disease prevention happens in very silent moments that do not necessarily make headline news. I can tell you that, and we all know that. From the matron who makes sure that there are proper IPC measures in place when she's attending to her patients daily, right? To that school student who has adequate knowledge of AMR, antimicrobial resistance abuse, disease prevention is happening already. So it's not a far-fetched thing. And also, diseases could also spread very easily. If you think about the butcher or the tomato seller who has very limited knowledge of hand hygiene, for instance, she poses a risk to her community. So these and many more things that DRASA has in the pipeline will not be achieved with short-term donations and shifting donor priorities. We need to have a permanent engine, a permanent source of generating income that will outlive donor priorities. We don't need to check, oh, okay, what's the implementation plan? What are they focusing on? What do they want right now? Oh, what's the new policy? Like it happened this year. We have a permanent income generating mechanism for DRASA that will ensure that DRASA's work is sustained over time beyond this decade and on and on. That's another good place to clap your hands. Thank you very much. Yeah. So now that we all understand what the endowment fund is about, we have come to a major highlight of this event, which is the actual unveiling. And before we do the actual unveiling, we all will recite DRASA's endowment promise. And I kindly request that you say these words after me. After we say these words, we're going to take a count from 10 to 0. And at the count of 0, with all the excitement you can gather and the joy in our hearts, we will unveil DRASA's endowment fund logo today. So please say after me. DRASA is preserving principle. Say preserving principle. Powering impact. Protecting Nigeria's health for generations. Preserving principle. Powering impact. And protecting Nigeria's health for generations. I tell you, what makes me feel very good and very excited. Woo! Yes. Thank you. So, yeah, we're all going to take a count at this moment from 10 to 0, and at the count of 0, we unveil the endowment fund. So, at the count of 3, we start from 10. Yeah. 1, 2, 3, go. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0. Yes. Yes, thank you. Thank you very much. Thank you. Thank you. Thank you. So this is our endowment fund promise. Preserving principle, powering impact, and protecting Nigerians' health for generations. And I tell you, it is worth every single dance step. Yeah. Thank you very much. So now, way forward. How can you join the train? How can you support this cause? And what can be done to support DRASA's vision? On the screen, we have the QR code that you could scan. When you scan the QR code, it will take you to, we should have the QR code on this, thank you, yeah. So when you scan this QR code, it takes you directly to our donate page, or make your donation, that's what it's called. And then of course you have the bank account details here. It's a GT bank account, Naira and dollars. In case you want to give in euro and pounds, when you go to that same page through this QR code, you will be able to make your donations. And just in case you're more comfortable with doing a direct bank transfer, right now the ushers in this hall have the transfer details. Apologies, they have the POS machine. Yeah, if you want to use your ATM card right now, you could just notify an usher. The usher will bring the POS machine to you, and you will be able to make your donation. In case our online audiences, I'm sure you can hear me, we have a very safe and secured platform for your international transfers on Paystack. So these are the very many ways that you can make your donations today towards our endowment fund. We promise you that if you become a partner and you support this cause, we will keep you updated. As I said earlier, we have a fund manager who's going to be managing these funds. In the next 3 months, you will hear from us. We're going to be sharing more updates on the endowment fund. I will not leave the stage without letting you know that our endowment fund target is 15 billion naira per year. Woo! And yes, we can, right? Yes, we can. 10 years down, forever to go. Yes, we can. So that's our target. We're making progress, and we're gonna continue to make progress. Just in case you want to be acknowledged after your giving, please let any usher know. We will appreciate you. And if you want to remain anonymous, we respect your privacy and your preferences, but just know that your gift, no matter how small, however it comes, is welcome. There's also a pledge commitment form that you will find when you scan that QR code. You may not be in a position to make your donation today, but you want to make a commitment. It could be monthly, it could be quarterly, it could be annually, and it could be, however suits you. Please know that we deeply appreciate you. If you need any further information about this process, I remain Ogome Emembo, Partnerships Manager, DRASA Health Trust. I'm at your beck and call. I can do another dance if you need it, and you will get every information you need. So on behalf of DRASA Health Trust and the board, thank you all so very much for giving to this cause.
Yo, make some noise one more time for Ogome Emembo. Amazing, amazing. As she said, please make use of the pledge forms. Please donate. Scan the QR code, make a commitment. We also want you to...
Happy 10th anniversary, DRASA.
Okay, just hold up. We also want you to be an ambassador for DRASA Health Trust. So if you know partners, possible donors who are not here present, you can actually share with them as well. People who you know will be interested in partnering with us, please do that. And no amount is too little. Everyone should make a pledge. No amount. It's all of us coming together, and everyone's contribution will be appreciated. All right, we have a couple of goodwill messages that we'll take. We still have our documentary that we are going to continue viewing. But importantly, please, we want you to already start making those commitments and fill the pledge forms. Some people are not, I can't see you, opening any website. I'm not judging you. I'm just noticing that you are not opening any website or scanning any QR code. But we will like for you to do that and then get on. Okay, so we're going to have a goodwill message whilst these donations are happening. We might also do a quick photo goodwill message now. Can I invite the Managing Director, NEPZA, NAPZA, Dr. Olufemi Ogunyemi, to give a goodwill message. Can we put our hands together for Dr. Olufemi Ogunyemi? You're very welcome, sir.
Give me this opportunity to say something I've been meaning to say for years. But before I say it, I have to pay respect to the Chief of Staff, to the President, Right Honorable Femi Gbajabiamila, to any ministers, ex-ministers in the House, my colleagues who are heads of parastatals. The thing I want to say, it's not really a goodwill message, but it is in a way. There is something Dr. Stella Adadevoh did that is been overlooked for the past 10 years. Something that's changed medical practice across the world. And I just thought in the last 2 minutes when I asked Nini's permission, that this is an opportunity to make it public. You see, there's something we call the Hippocratic Oath. All doctors swear it. I swore to it 42 years ago. Somewhere in there, there's a principle that goes by like, first do no harm. Lawyers will call that the principle of non-maleficence. When Hippocrates wrote that oath about 400 BC, his intention was that if you have a patient, even if you don't know what is wrong with the patient, even if you know what is wrong with the patient but you don't know what to do, you first do no harm. Now, in those critical moments when Dr. Adadevoh was faced with, as Mrs. Williams said, fear and uncertainty, she rephrased that principle of non-maleficence. It was meant to be do no harm to the patient. But in those few seconds, she put you and I, millions of people, ahead of the patient and turned it to first do no harm to the public. This was not the original intention, and people overlook this. So nowadays, any doctor, any emergency doctor in any situation, anywhere on this planet, can decide not to put the patient first in certain situations and to put the public first. This is due to that singular act done by Dr. Stella Adadevoh. And I think she deserves some applause for that. Thank you very much.
Thank you so much, Dr. Olufemi Ogunyemi, for a reminder of that sacred oath that we all, whether consciously or directly or indirectly, for better health outcomes for our nation and our communities. Thank you so much. All right, we want to do a quick photo session. Remember, this is the main activity happening right now. Your partnership fuels the next decade for DRASA Health Trust. So we thank you. We know that you don't need that much convincing to at least make a commitment, however little, to pledge to be a part of DRASA Health Trust. All right, so while that is happening, we're going to have quick photographs. We would like to call on our special guest here, led by the Managing Director of DRASA Health Trust, the representative of the Minister of Health, the Chief of Staff of the President, the former Minister of Health, and all our other dignitaries in front, as well as the members of the board of the DRASA Health Trustees, to just come up for a quick photograph. Can we just celebrate our Board of Trustees one more time with a round of applause? The DRASA Health Trust Board of Trustees. It's a commitment to improving the health outcomes for Nigerian communities and African communities. We also just want to thank all our different partners and friends and donors and champions and all those who have been supporting through the years. Well, I've just received a notification. A donation has been received. Can we put our hands together? I hear that we have some donations that are coming in foreign currency as well. We are accepting Bitcoin and other cryptocurrencies as well. So we'll provide with a Bitcoin address for all of that. A health champion for Nigeria, someone who has been part of the DRASA Health Trust story. He was Minister of Health when DRASA Health Trust was founded 10 years ago. Professor C.O. Onyebuchi Chukwu. He's also a member of the United Nations One Health Global Leaders group on antimicrobial resistance. And today he's going to tell his own story and talk about all that he's observed with DRASA Health Trust. Ladies and gentlemen, please, can we welcome with a warm round of applause, Professor Onyebuchi Chukwu.
Bankole Kadoso, distinguished guests, distinguished participants, ladies and gentlemen, October 20. October 20 means several things to me. October 20, like you had several times said, was the day I personally received on behalf of Nigeria the WHO Ebola-free certification for Nigeria in 2014. October 20 was also my last day in office as Minister of the Federal Republic of Nigeria, because I had other interests to pursue, which may not have been realized, but good experience. October 20 is also my sister-in-law's birthday. Incidentally, the son accompanied me to this event. So today is her birthday, and the son is also here witnessing what is happening. But it's also very significant that that day in 2014 was also a Monday like today. So it was actually Monday, October 20, 2014. But we're here celebrating a different October 20. For October 20, 2015 was the birth date of the DRASA Health Trust. So congratulations, DRASA Health Trust. DRASA 10, very important and remarkable milestone. Well done for all you've done for the country. Congratulations. But I think I'm starting my talk from the end. Let me go back to the beginning. July 19, 2014, I left Nigeria for a place called Melbourne in Australia to represent the President of Nigeria at that year's World HIV/AIDS International Conference. I was also invited in my own right, but of course, becoming a president somewhere took the better precedence. On 22nd of July, I was coming back and we stopped over in Singapore, where I was expected to change flight because I was coming back through Europe. And on disembarking from the aircraft, and what all of us do instinctively, you know, it's like we just can't do without this thing called a mobile phone since we started having it. So even as we're in this soil, you see people just looking at it. It's not possible to be without your phone anymore. So immediately I disembarked. Of course, I switched on the phone. And I saw there was a missed call, but just about then, the call started coming in again. And it was coming from the then director of the Nigeria Center for Disease Control. It's now called Nigeria Center for Disease Control and Prevention, the NCDC, Professor Abdusalimi Nasidi. So of course, for a Minister of Health, who also established that center, it's very important call. So I immediately took it. I didn't even gotten to immigration control, so I just took it right from where we are and said, Honorable Minister, it has happened. So I was like, who died? He said, Nigeria now has gotten its first Ebola case. A very serious statement. But of course, as being a medical doctor, being a surgeon, the way we are trained, even when you hear the worst message, you keep your face straight. So I said, okay, thank you for calling me. What have you done? Is the Minister of State aware? Is the Permanent Secretary aware? Director of Public Health? So he said yes. I said, okay, fine. What you do, summarize what has been done so far and send it to my email. So that's how the news came to me. But of course, deep down, my thinking was from a different. From there, I started making several calls, sending many text messages, until I got back to Nigeria in the afternoon of July 23rd, 2014. The president then incidentally was outside the country, but came back the next day, the 24th. So one of the first meetings he had when he returned to Abuja was with me as Minister of Health. And of course, we had already called an emergency meeting in the ministry. So there was no more rest. I couldn't even tell my family what I did in Australia, what I found in Australia. We were now talking about the challenge. Well, success has its own good side. Failure always will have a bad side. But when something is good, everybody lays claim. And so our sister, Dr. Stella Adadevoh, did something that should be the driving force of all of us. And I believe it was because of such spirit that Nigeria largely conquered Ebola. It is the same spirit that eventually made us to be looked up by the rest of the world that we could do something. And what is that spirit? Spirit of diligence, spirit of courage, spirit of patriotism, spirit of being stubborn. You know, stubborn has two sides, and I will tell you how it had two sides on Dr. Adadevoh. But being stubborn could also be a virtue, sometimes maybe a vice, but more of a virtue. Of course, we all knew what eventually happened. Now, I just feel that fate directed Mr. Patrick Sawyer to her. Why do I say that? Why was it at that period that all doctors had down tools in all public health institutions? Remember that the doctors, both consultants and resident doctors and nurse officers under the name of NMA, Nigerian Medical Association, we are on strike at that period. Probably, if they were not on strike, when Mr. Patrick Sawyer, on that fateful July 20, 2014, collapsed, would have been taken to the Lagos University Teaching Hospital, LUTH, or you have been taken to the Lagos State University Hospital in Ikeja, Lasut, or you could have been taken to any of the general hospitals. But there were no public hospitals functioning at that period. And so everybody's mind was on private institutions, and working at First Consultant, everybody knew that hospital was good. Many heads of state and their families have been treated in that particular hospital. And so that's where Mr. Sawyer was taken to. And that was how our sister encountered this patient. But are there lessons to have been learned? Because speaker after speaker has said the only thing that will make that kind of huge sacrifice, that supreme sacrifice, what it is, if those of us who have survived her can learn from that and implement that. Have we learned anything? I don't think so. DRASA, you've learned a bit of it, and you are trying to force us to learn something. But we've not learned anything. Because if we have learned something, why are we not practicing universal precaution till today? But every time we have an outbreak, we remember it. After the outbreak, we forget. So COVID made us to remember. But after COVID, I can assure you, we have forgotten. Now, there are things I want to claim from the success of Dr. Stella Adadevoh. One is that, like I said at Holy Cross, those of you who were there, I said in a way, I wasn't just relating to her as a doctor. I knew her and the family in a way, because somehow I cannot fully tell my biography without mentioning at least one member of their family. How? Because when I entered University of Lagos, I was matriculated by the father, because the father was the vice chancellor of the University of Lagos at that time, Professor Babatunde Kwaku Adadevoh. So he matriculated, and that was the first time. It's not like these days when you have, students, every little thing you run to the VC. Who are you to be going to the VC when the head of the department can sort 99% of your problem? That was how universities were in those days. So there are only two occasions where you may have the opportunity to see the vice chancellor, apart from seeing him on TV. One is matriculation, and of course the other one will be the convocation when you are no longer a student. But as a student, often the only opportunity is during matriculation. And I could still remember his address, because he was a very good orator. I could still remember his address to us on that fateful day when we were matriculated. So that was one. But the second connection is that she was there in my medical school. The year I was coming in was the year she was leaving. So I'm from University of Lagos, she attended University. But I met the younger sister, who today is here also, Dr. Ameyo Stella. So she was, I think, a year or 2 years my senior, but we met on campus there in Idiaraba. That school has produced many people who played a great role in this Ebola, including the current DG of the NCDC, Dr. Jide Idris. I also met him he was also my senior, but I met him in University of Lagos at Idiaraba. So I've had that kind of connection. So once I hear Adadevoh, I say, well, anytime you are putting anything about your biography, there's no way that Adadevoh name will not come there. But we were all concerned, and of course, when she was admitted to be treated, because she started getting symptoms actually before the admission, but very strong doctor, very so willed and all that, and of course nobody knew how to treat Ebola until the WHO DG sent us Dr. Peters, who came, a white chap, who had experience treating Ebola in Central Africa. So that's how Nigeria started having someone. So that doctor alone was catering for everybody that was initially admitted. And of course, we were not prepared in the sense that we didn't have a proper center for doing that. And so we had a makeshift at the mainland hospital in Yaba. But what is important, which has been said again here, is that where people remove politics, throw politics away, and are ready to work together as a team, there's no obstacle that cannot be surmounted. And I must say that that was my approach as minister. Remember at that time, the federal government had a PDP government, but Lagos State was now under APC. It had become APC. But we tried our best, even though some people refused. But the politics affected all of us. And when the family of Stella Adadevoh went and gave a press conference that she wasn't being looked after at the time she finally got admitted there, I had to travel from Abuja, to Lagos. And we had a meeting. I remember that meeting, the family was led by Dr. Bozo Ekweme, one of the wives of the late Vice President of Nigeria, but the Vice President was still alive at that time. I guess she's still, I've lost communication with her, but I guess she's still there, probably in her 80s now. So she led that meeting on behalf of the family, and Dr. Jide Idris was there. We didn't allow too many people. It was a close, of course, the media was there waiting for the family to come to meet us. So we took photographs, with the media, and told them, don't worry, we'll brief you after the meeting. So after about 1.5 hours, we came out from the meeting. And with that, we also strengthened the care we were giving to our sister. We thank people like Professor Akin Oshibogun, who was the CMD of Flute then, moved massively some of the intensive care critical equipment to that mainland hospital so we can sustain our sister. So when, as it happened on the 19th of August and we lost her, it was a very painful experience. But for me, I want to say things that we should keep up with, which we learned during that period. One, we should be playing politics with things that hit at the nerve center of our country or our continent as it were. Two, we should spare no effort the way we did during Ebola. In fact, we didn't spend so much money because for me, I don't believe we should be inflating costs because we're in danger. Even as a doctor, I don't think when you see a bad patient, that's the time to triple the cost. Just charge what you normally charge anyway. But what's important is using the funding very well. We use the funding very well up to a point, but like why I'm telling this story is so for all of us to learn, but at a stage, because we left, by the time I left, out of the 2 billion that was given to us, we still had almost like 1.6 billion remaining by the time I left as a minister. Because we were getting help from many organizations, so most of the things we even thought we are going to spend that money on. We didn't spend that money on. But one of the major things today, I feel bad, maybe I shouldn't have left my office, is that some of the things, equipment we've already negotiated to buy, mobile equipment. Remember that mobile equipment we used for Enugu and Port Harcourt was originally donated by the EU for Lassa fever, and it was stationed in Irua. Remember that those of you who are still old enough to read newspapers at the time, because 11 years is a long time. If you remember then that I had to give instruction for the thing to be moved from Irua to Enugu to contain the Ebola when it happened in Enugu. Remember that it was the same lab, mobile lab vehicle that we moved to Port Harcourt that helped us to control the outbreak when it got to Rivers State. Today, we don't have that when we had actually provided for it. But as far as I left office, I can't answer any more questions on that. Now, the other lesson I think we should continue to learn is that it's easier said when you say, we are teaching people how to be aware of it. Look, nobody, nowhere in the world is anybody ready for any emergency. Quote me any day. USA was not even ready for this Ebola. No place is ready. Because what we should be doing, we don't do. The same way people do fire drills should be the same way we should be doing drills for health emergencies. So DRASA, if you are going to help Nigeria, see how you can be sending us alerts every quarter to ask those who are still in power today, will you be ready if we have the next outbreak. Then the other lesson is that it's good to work as a team. Teamwork is good. I commend the state governments who participated in that control. Lagos State, teamwork, we worked very well. Jide Idris was the Commissioner for Health. We worked together. A few people tried to play politics, we removed that politics. We went to Rivers, we worked together. Kudos to Rivers State, even the governor, when we thought we couldn't get anything, I think it was Rotimi Amechi. Once I called him, within 12 hours, he provided everything. Kudos to the governor in Enugu State, in Anambra State. They were wonderful. But after the thing, I started asking, is it the same wonderful people we had? I'm sure you're asking the same question. Now, there's a bad thing, which is another story because my time is up. There's a bad thing which I'll tell the story on another occasion. Believe you me, we had recommended for heroes to be declared after that, after the burial of Dr. Stella Adadevoh. I remember that night I didn't sleep. From 10 p.m. to 5 a.m., that was when we concluded between me and Dr. Ruben Abati, who was the presidential spokesperson, because the president had given the two of us a task to draft an address he was going to make that next morning. And in it, we had proposed those who were supposed to be the heroes. But eventually, after that kind of hard work, we weren't together. I was in my house, and he was in his own house office. But modern technology has made it possible for us to be going to and fro with drafting that address. He was to put it in the language of the president. My job was to make sure that they were factually correct. And after that sleepless time, we now got the address later on. And it was different. And when I asked, I was that people in Lagos opposed making our sister a hero. Another story for another day. Yes, don't worry, forgive everybody. Some of them are parading themselves. They are actually people promoting her now. When I see them, I'm like President Jonathan, who said that when you see people who talk about corruption, he laughs. The same way when I see people who are making noise about our sister today, more than me, I laugh because they opposed it. Well, something good came out of our efforts to control this disease. One is the African Centers for Disease Control and Prevention. I'm sure you know about it. It was born because the whole of Africa felt the NCDC did well during the Ebola crisis. So if they could do that in Nigeria, our country have something for the whole of Africa. The other thing that came out from it also is the ECOWAS Regional Center for Surveillance and Disease Control, which is for the West Africa. In fact, up to today, NCDC is still hosting them. Finally, when we talk about Nigeria borders, I laugh. Even us, we are looking at the main borders of the country, thinking this disease will come through semi-border. It will come through Idiroko, all the named borders. But you know, Ebola came by air into Nigeria. So what is the message? The unexpected will always happen. Expect the unexpected, that's the conclusion. But you're talking about Nigerian borders. Ebola made me to know that we're just wasting our time. It's the unknown ones you know now. Majority of the borders, there's nobody there. And people cross in and out. But Nigerians are good followers. If you do the right thing, they follow you. If you do the wrong thing too, because they are good followers, they follow you. So they followed us during Ebola because we decided to be honest to the people. We decided to be transparent. We decided to tell people the way it was. We decided to carry them along. Initially, they were skeptical, later they started following us. But they are also bad followers. They like to follow. They are good followers in a way. That's why if I have a siren and I drive against traffic, everybody will not join me. So it's for us leaders to decide that how do we lead these good followers? Do we do the right thing so that they always follow to do the right thing? Or do we continue to do the wrong thing so that they continue to follow to do the wrong thing? Congratulations, DRASA. May God continue to guide you people. God help you. You have a noble cause, and I'm delighted to be here. Thank you very much.
Ladies and gentlemen, can we celebrate one more time our former Minister of Health? Professor, thank you so much for that really passionate and honest call to responsibility and integrity, both for leaders and citizens and other stakeholders in the health sector. It's truly all of us coming together to do the right thing that can help our country going forward. I love what you said about how it's really tough to tackle emergencies, but I think Nini said it when she said that behaviors that prevent infections every day, they are daily behaviors that help us prevent infections, can also help during emergencies and outbreaks. So the work that the champions are doing in the community to just help people improve their daily health habits, they add up to help when emergencies come. But thank you so much, Prof. Can we put our hands together for Prof one more time for that passionate call, rallying call. Thank you, thank you, thank you. All right, we have another champion, another voice that we will hear from, a voice of Nigeria's health. And right after that, we're going to have a panel discussion with some of our community members, and then we will make it interactive, okay? Right after that, we'll cut this cake and have a little party. Ogome will be back to give us some more dance steps and the rest of the crew as we start to bring this to a close. Our next speaker, I'm just going to quickly introduce him and say a few things. Actually, before I do that, allow me to just touch on a couple of things from Professor. During his tenure as Minister of Health, Nigeria was certified guinea worm disease-free by the World Health Organization. I think we should celebrate that. Polio was interrupted in the country. Nigeria recorded significant improvement in other key health indices. By the time he left office, maternity mortality had decreased, infant mortality had decreased as well, and life expectancy at birth had increased from 47 to 54 years by the time he was done as Minister of Health. And yes, that round of applause can be loud. And I think his call today is for public servants and for people who have the responsibility to continue this good work to be committed to doing that. So thank you so much, Prof. Our next speaker is Dr. Ibrahim Mohammed, a consultant clinical microbiologist and HOD medical microbiology and immunology at the Gombe State University, Federal Teaching Hospital, Gombe. He is also a prevention and control specialist, a senior lecturer, a native of Gembu in Sadauna, local government of Taraba State. He has degrees from Bayero State University, University of Lagos, the National Postgraduate Medical College of Nigeria, an MSc in Infection Prevention and Control from the University of Dundee, CIC certified by the US Certification Board. Basically, he is a guru. Ladies and gentlemen, please put your hands together for Dr. Ibrahim Mohammed.
Good afternoon, everyone. I will just stand on the already established protocol. But before I go further, I just want everybody to know that Ms. Williams was my lecturer when I was doing the diploma course in infection prevention and control. And perhaps, on Friday this Friday, after the diploma course, I was also inducted to be a facilitator in the University of Lagos. And the part of the course she took me is what I'm now the facilitator in that course, and I could remember risk assessment in IPC. Okay, for people that know Northeast Nigeria very well, they would know Federal Teaching Hospital Gombe is one of the state-of-the-art facility in the Northeast. We do have a well-established infection prevention and control program that is staffed by dedicated and well-trained professionals in Nigeria. And it is in this Federal Teaching Hospital Gombe that we have the highest number of trained infection prevention and control specialists in the whole of Northeast. And I'm privileged to be the chairman of the infection prevention and control program in that. So this afternoon I'll be sharing with us just a story, in as much as we do good work in Federal Teaching Hospital Gombe, we also have work that we do, but with lapses that will result to infection in the hospital. But the lesson that we learned from this is that We do have strategic people put in place that when this thing occur, we also have method put in place to identify them early and prevent further transmission. Infection prevention and control is like a specialist in medicine or medical field that encompasses all the healthcare professionals, the protocols, the practice, and evidence-based measures that when put together collectively will lead to not only prevention of infection in the hospital, but as far as preventing infection also in the community. And for this to be very effective in hospitals, every of those hospitals need to have a well-established infection prevention and control program that is manned by adequate number of trained staff. And at this junction, I will gladly say in Nigeria, the bodies that are responsible for training people in infection prevention and control, classically the Center for Infection Control and Patient Safety in Lagos, and as well as DRASA Health Trust. So the story I'll be sharing with us occurred in 2021 in a small ward in Federal Teaching Hospital Gombe called the Special Care Baby Unit Ward. In this Special Care Baby Unit Ward, healthcare professionals there manage children or babies that are less than 28 days old. And on this fateful Sunday, this lady there is Fatima Baba Ali. She is a dedicated scientist. She was working on the bench on a Sunday, and me and my colleagues were in the office preparing questions for medical student exams. So she identified a rare organism from blood culture of 3 different patients. These patients were at age less than 7 days old. So she did not hold up to that, because if she had kept the result, because it was on Sunday, they will not come looking for this result till on Monday. And that delay will have changed the story. She immediately came to our office, knocked at our door, and said, I just identified an organism that is resistant to almost all the antibiotics, and the patients are all coming from the same ward, and all of them are aged less than 7 days. So immediately, myself and our colleagues that were there collected the result and moved straight to the Special Care Baby Unit. On arriving the Special Care Baby Unit, we saw the consultant pediatrician. In as much as it was on a Sunday, she had come to review her patient because the drugs or the antibiotics they were giving were not yielding result. So when we enter, we could see a sign of relief in her face. We said, we are coming with your result, and unfortunately, it is a multi-drug resistant organism. All the antibiotics were resistant. The only susceptible antibiotics was the antibiotics that is always left or kept as last resort. And in our hospital, because we have an antimicrobial stewardship team, we restrict prescription of that antibiotics only when it is reviewed by members of the team. Unfortunately, she was a member of the team, and myself, I was also a member of the team. And together we discussed, and we said, okay, since these babies are still alive, let's prescribe these antibiotics. The antibiotics is also very expensive as well. So the relatives and the parent could not afford these antibiotics. But fortunately, a call was made to the social welfare of the hospital, and they granted a waiver. We got the antibiotics, and it was started immediately. But we didn't stop there, because we needed to know the source of this infection. Because for these patients to come down with the same organism, that means the source will have likely emanated from the hospital. We asked questions. You could look at the ACBU. It's one of the neatest wards in our facility, and the staff in that ACBU are one of the IPC compliance staff in our facility. So we asked questions around, and we could not arrive at the cause. But on looking at the folder of the patient, we realized that all of those patients were delivered in our facility. And immediately after delivery, they were all suctioned using the suction tubes and the suction machine. We now escalated our surveillance and our review to the labor ward. On getting into the labor ward, we saw the suction machine. The suction tube was lying down, and we could see purulent matters on the tip of the suction tube. So we said, how do you disinfect your suction tubes? The answer was, we do not disinfect suction tubes because we have extra sterile tubes that we attach to those tubes whenever we want to suction. And then we took the sample from the tube, and then we gave it back to the scientists that processed the sample, and within 48 hours, the organism that we isolated from the blood of this patient was the organism that was present in those suction tubes. Now, we had to educate the staff there. We also tell the management to buy extra tubes so that after every 24 hours, all of these suction tubes will be cleaned, disinfected before use in the next 24 hours. But we felt if we had just allowed this intervention only at the SCBU or at the labor room, other places in the hospital where we have the cost to use also this suction machine, they will have the cost to also spread this infection to others. And immediately we went to strategic places. We went to ICU and we went to the theater. But fortunately, because the theater and the ICU were very IPC compliant, on getting to the theater, they had just finished surgery, and we asked of the suction tube, they showed us a place where they were already clean and jigged inside a disinfectant. That means they already have something in place to prevent that. We went to ICU, they already had a program for disinfection and cleaning all these suction tubes. We now went to the other wards. All wards did not have any measures of cleaning and disinfecting these tubes. So we had to train the whole facility, train every healthcare worker that was responsible on how to clean and disinfect suction tube. And we also made it upon ourselves, and then we also encouraged management to also buy extra suction tubes for every suction machine in the facility, such that once it is disinfected, it can be allowed to hang for 24 hours while the other is kept in use. And I think in 2022, I presented this paper at a conference, virtually anyway, at a conference in Bangladesh. I explained this, and I thought it was just something that will have occurred in Nigeria. But the question I was receiving is, most healthcare workers, even globally, most healthcare facilities, even globally, do not have that template of cleaning and disinfecting suction tubes globally. And with this, we made an impact, and we made suggestions on how to clean and disinfect all these things. The 3 patients survived. There was no mortality, and there was no further spray. But the lesson we learned here from this story is that if you do have a well-established program, you need dedicated staff. The pediatrician, we are very swift enough to take that sample and send to the laboratory within the shortest period of time. If they had delay for 2 or 3 days, the delay will have cost the patient life. The laboratory scientists that did not only isolate or identify this organism, also took it upon herself to escalate, the report to other people that will also escalate it elsewhere, was also part of the most important thing that they did to have this success story. And behold, I want to endure every stakeholder in a healthcare facility to make sure that every hospital establish a very good infection prevention and control program, and this program should be manned and staffed by adequate number of dedicated healthcare professionals. If we so do this, infection prevention and control in our hospital will be a thing of the past. Thank you so much.
For Dr. Ibrahim Mohammed, consultant clinical microbiologist, thank you so much. I thought that was really powerful. And these two speeches and this segment of the day was really to showcase the power of individual action to impact health outcomes and prevent the spread of diseases. And just like Dr. Stella, Ameyo Stella Adadevoh did, we've just seen, another example of how, someone's application and individual action can, stop the spread of diseases. So thank you so much for sharing that example and encouraging us all to apply ourselves in that same way. All right, we still want to continue with this conversation. Now we want to hear from some of our DRASA champions. And these are community voices. These are health champions. We're going to have a community health champion and 2 student health champions. And I believe they're all here present. Fantastic. So we're just going to have a very quick conversation. The first person I'm bringing up is Mr. Sunday Ajayi, who is a community health champion. Can we put our hands together for Mr. Sunday Ajayi? Please come on stage. We also have Miss Glorious Eruhanga. Forgive me if I've butchered your surname. Miss Glorious Eruhanga. Can we put our hands together for her? As well as Miss Precious Adesoye. Miss Precious Adesoye is also a student champion. They deserve your round of applause. All right, fantastic. So we're just going to have a very quick conversation. And then right after this, we'd invite Prof and Doctor to join us and would take 1 or 2 questions from the audience. All right, so my first question is for Mr. Sunday. From your work in the community, can you share 1 short story of how local vigilance can prevent the spread of diseases? We already saw 1 example from the one that Doctor just shared, but how else is local vigilance important in preventing the spread of disease?
Good afternoon, sir. Good afternoon, ma'am. Our protocols duly observed. From my own experience on the field, we've achieved numerous achievements since the incursion of this program, among which I've been sharing with us shortly. On one fateful day I was on field, I saw a mother, a woman that backed a baby. And people draw attention that the baby is stooling. And the stooling is coming out of the cloth that she used to back the baby. So the woman quickly dropped the baby and allowed the baby to continue stooling. So I saw the baby was already weak. The mother didn't even know what to do again. So I always have ORS in my bag during the outbreak of cholera. So I quickly brought out ORS. I looked for a place where I can get a bottle of water. I bought a bottle of water. I mixed it for the woman, that the woman should give the baby. The woman was expecting the baby to stop stooling before she proceeded on her movement. But I quickly alert her that she should use that soaked cloth. To carry the baby, I stopped a keke marua that I paid the marua, that the marua should lead the mother to health center. While doing that, I called one of the doctors at the nearest health center that a child will be brought to that site shortly, that the child needs urgent attention, of which they did. So after they left, I called one of the parents in the said environment that they should please sensitize that place where the child stool and vomit, because the stooling looked like parboiled rice water. I sensed this cholera case. On getting to a facility, so one of the doctors that attended to the child, the doctor was staying, the stooling and vomiting all over the body. But to God be the glory, they attended to the child. The woman that backed the baby was crying, not knowing that the child is even not a child. So the mother came, they were all crying. But the doctor said they shouldn't cry anymore, that if the child left untreated in less than 30 minutes at that spot, it could be another story. So the child spent like 5 days at the hospital, but to God be the glory, the child is alive today. Another one that I've seen shared shortly was the case of measles case. The measles didn't appear as rashes all over the body. It appears at the lips and the eye. the eye and the lips was reddish in color. So I saw the mother on feet too. So I asked the mother, what happened to this child? The child was stressless, and the mother too was confused, merely looking at her. So I challenged the mother, what happened to this baby like this? It was the person that stood beside her that answered my question, that the child was strong. They've been giving the child different kind of herb, local medicine, that no changes. So I told the mother that, can she please took the child to a facility, of which the person that stood beside her said, even if they are to take the child to a facility, there's nothing to, I just said they should just go. Everything is not about money. That the child is more than money. So then I told the mother that it's like it's the sign I'm seeing is a sign of measles. Then the mother said, they've said we shouldn't be taking injection for measles or this or that. I said that was then. I was able to convince the mother, and they took the child to health facility. They gave the child proper care, and to God be the glory, we were friends today, because I don't know them from Adam. We don't know each other before. Another one that we see share shortly was the woman that was selling fruit. I saw the woman, she was dicing fruit. So I just saw her all over the body. It was all rashes. It was a chicken pox case. So I challenged the mother.
And you were about to buy fruit from her?
Yes.
Okay.
Say, Ma, what is all about? Have you visited any health facility? She said, no, I've taken some herbs that it will soon go. So I changed my mind. I tried to address the situation. Can you please visit the nearest health facility? Everything is all about money. I could see the face that the woman is about changing it for me. So I quickly apply wisdom. I left the situation. I went to health facility. I called one of the disease surveillance and notification officer, Madam Folashade, that I saw a case in social place, and I sensed his chicken pox all over her body and her child. So she said, oh, let's go. I'm not going with you. You are government worker. She will find it difficult to fight you, but see me in the community tomorrow, oh, I'm in trouble. I just gave her the address, and she went straight with her team. To God be the glory. She addressed the situation, and she was able to brought the woman to health facility, and they gave the woman proper health care with the child. The fourth day, I passed through the place. Then I checked the mother. She said, I asked her about her well-being. She said, oh, thank you. I've been to health facility, and she's getting better now. That she never knew such situation is being addressed with injection and medical drugs.
I think we should celebrate.
So another one that I will still mention.
No, hold on. Just, I'm sure you have a million stories, But let's celebrate that. Let's celebrate that. And I'm sure that you can tell like 20 different stories, right? But he's one of about 100,000 health champions across Nigeria. Just listening to him, clearly we need more. We need more. It's almost like we need at least 10 or 20 in every local government. Is that right? So the next question, just before I move to the students, is in 30 seconds or less, if you can, could you tell us how DRASA Health Trust trained you or prepared you to be able to be vigilant and to pick up all these different signs? Quickly, if you can.
Okay. We had a lot of sensitization on vaccine preventable diseases, infectious diseases, both infectious and non-infectious diseases. Then we were taught on how to protect ourselves in case we met people in danger, someone that is having severe cases. Then we were taught on how to train ourselves, our family, on personal hygiene in case we contacted people with such infectious diseases.
So there was in-depth training by DRASA Health Trust that
sir.
prepared you to be able to do this work. Can we put our hands together for that one more time? Now, I want to go back to Glorious. Who's Glorious? Okay, Glorious, fantastic. What was one defining moment as a student in the DRASA Health and Hygiene School Club that made you realize that you can make a difference? And do you have any stories in school of how you've made a difference?
Good afternoon, everyone. Thank you so much, DRASA, for this wonderful opportunity. And happy 10th anniversary. So, one defining moment, actually there are moments, but you know, I remember when I traveled down to Osun State from Lagos State. So I traveled to Osun State. I visited some schools there, spoke to them about DRASA, what DRASA is doing. I spoke to them about AML because I got exposed to DRASA like at a very young age. I was in secondary school then, and now I remember when I was introducing myself to the students in Osun State, I was like, hello everyone, I'm a 100 level student of the University of Lagos, and now I can say that I'm a final year student of the University of Lagos. So, you know, my experience in Osun State was a defining moment. I didn't even know that I could do something like that, speaking to young people like myself, telling them about DRASA, telling them about AMR. What did I know? I was an art student, so DRASA came to my school and they were talking to me about these things, telling me about, antibiotics, and I was really interested because I didn't know about all these things before. Then going to Osun State and teaching fellow students like myself too. So it was a defining moment. That was not even the major thing. I got back to Lagos from Osun State and I was just on my phone. I came online, then it was Facebook. So I came online and I got a message from someone, Favor Adesoye. That's her twin sister. She messaged me and she was like, hi Glorious, thank you for everything. I love everything that DRASA is doing. And she was talking like she was she was part of DRASA Club, but she wasn't. It was her sister that was a member of DRASA Club. Then it happened that Precious went back home, and Precious told her everything that happened, the lessons that she learned. Then the both of them, since they didn't get my contact, then they had to storm the internet, search for my name, Glorious. I think when she was telling me, she was like, I was the only one being Glorious. And I was like, it has to be because my name is special. So they had to message me because they got my information online and they messaged me, and I saw that really I might not know that, okay, I've been a great impact to people, because that was like a normal thing, just speaking to someone and looking at the distance, coming from Lagos and going to Osun State. I didn't expect much because I didn't drop any contact with anybody. I just went there, I spoke to them about DRASA, proper hygiene, and other important health issues. So going back, it made me see that whatever you do, people are watching, people are learning, and people are being influenced. So I saw that through my action, just talking to one person, then the other person going home to tell her sister. Yeah. So that was a defining moment for me, and I can never forget. That was in 2022. So
fantastic.
That's a major highlight.
And since you guys are, would you say you're Gen Z?
Yes.
Okay, good. So you guys own, social media, TikTok, Instagram, Facebook. So I imagine that's your platform now to continue to disseminate this information, right? I saw you doing anything like that?
So I think there was it last week or every opportunity I get to, post about DRASA, because I love Miss Niniola so much that, whenever I see any updates on Instagram, I always share it. Like, I think the PR that went out this morning, I shared everything. So people always ask me, what's DRASA? Especially those people that were in DRASA club together, but they were not really serious because they didn't really see the future ahead. They were just so interested in the present time as at then. So they are like, Glorious, what exactly is this DRASA? So I think the last time that Landmark celebrated DRASA, that's Dr. Adadevoh, people reached out to me, what exactly is DRASA? Then I had to even remind them, oh, do you guys remember the doctor that died of Ebola? Talk to them about this. So using platforms like that, I use my WhatsApp platform a lot because I post about DRASA. So
fantastic. Let's appreciate Glorious. Now, over to Precious, who we've just heard is an ambassador and an evangelist for all things, DRASA. So tell us, why is early engagement for young people on the importance of protecting health, public health in Nigeria important? And what are some of your own thoughts, and personal experience?
Okay, good day everyone. I want to thank DRASA for for the opportunity given unto me to be here. Then back to the question. Youth make up 60% of Nigeria's population, in which a good number of them are under 25. So I can say, obviously, we are the largest population and the most energetic group. So involving us is not just important, it is necessary. And DRASA actually struck something deep in me when they came to my school in Osun State in 2022. I had always wanted to be a nurse. I want to care for people, but I did not see beyond that. But when DRASA came into the picture, I saw a bigger picture. I got to know that caring for people is not just about treating illness. The main thing is preventing disease. Now, I can say that early engagement of youth is going to build a generation that values prevention over cure, that values responsibility over ignorance, and also values action over silence. Because if not for their action, I would not see the bigger picture. I would just say that, okay, bedside nurse is good, but I see beyond bedside nurse now. I see a nurse that can go into the public, that can impact the public. I can stand before, I'm a shy person, I can't do it. But when DRASA came to my school in 2022, we actually made hygiene fun. The group got into section, they asked us to draw on cardboard. I was like, okay. So when we were presenting on the assembly, I was the one that talked on the group. I was so nervous, I was so shy, but it actually shifted something. It shifted something in my mindset. I say I can do better, and now I'm a 300 level nursing student of Osun State University. And I can say that DRASA actually did a lot. It actually did a lot. It shaped me into who I'm becoming. So I'm saying that together, like, if we engage the youth early, we can create a ripple effect that strengthens public health in Nigeria. And I see Nigeria getting better, one youth at a time, one family at a time, one community at a time. Thank you.
Come on. That was wonderful. And it's really one youth at a time, one family, one community at a time, really. And, it just shows that there's so much work to do. As I'm listening, I'm just thinking that our endowment fund, we need to make it happen, no? Because we need to train more young people. We need to get into the community, train more community champions like our gentleman over there. We're going to take questions. We will make room for a couple of questions online, but we want to take at least 2 in the room. So if you raise your hand quickly, we'll bring a microphone to you. A question or a quick contribution or thought to add to the conversation. If there's any hand that goes up, we can quickly get. Okay, there's a hand at the back there. Let's just quickly get that hand. Okay, go ahead. Yes.
All right, so thank you very much for the very impactful stories and, of course, for what DRASA represents. My name is Tolu. I'm a medical doctor. I work with APIN, Public Health Initiatives. So again, maybe the persons in authority who needed this information have left, but it's just to say that I remember 12 years ago when I was doing my master's somewhere outside the country, and a professor who took my class said to the 7 Africans in the room that if your continent could institutionalize its waste management practice, that you would have reduced disease burden by 60% in Africa. Therefore, my charge to the great work that DRASA is doing, and that's why I said I wish the authorities were here, is that Nigeria till now has not, and this is from community level to local government to state to federal, we have not, sort of institutionalized a standard waste management system for this country. And I feel that if you do not advocate for that, help that to be established, then some of these conversations of infection prevention may just really come to naught. And I summarize by saying this. The permanent secretary, Lagos State, I think Ministry of Environment, about 2 months ago, I saw that news feed where he said all the guys who live in Lekki are actually drinking fecal contaminated water. And you know the implication of that is also to say that even the conversation around how buildings are put up,
Right.
we don't run central sewage system in Nigeria. That's already a problem. So you put a borehole very close to where you have people's soak pits, and that's what you have almost everywhere. So that building control as well is what I want to add to say we need to start to champion that new culture that will be enforced such that we can, have that total waste management even for human.
Wow, fantastic. I think we should celebrate that. That's a very good contribution. But sir, allow me to also throw the challenge to you. I think that what we're celebrating here today is also the power of individual action, right? So since you're very passionate about this, I would say, what can you do as well, in your own little network, with your own little power of influence, to start to make these things happen? Because it's easy to say, let the other people do it. Let the people in power do it. And what Dr. Adadevoh stands for is taking individual responsibility and being the ones to instigate change. So if we all can take responsibility, then we can, in our own little pockets of influence, start to drive this change. But I think we should thank you again for your contribution. Okay, any other? There was a hand at the back. Yeah. Oh, there's no microphone. I like that you're ready to just give us with your natural voice. But
thank you very much. Please, I don't know, join me please as we clap for these beautiful people.
The health champions.
Yes, please. Okay, my question is very simple. Anywhere I go to, I try to say this. Yes, AMR is a big thing in Nigeria. First of all, my name is Rachel Abuja. I work in News Agency of Nigeria, public health journalist. We have serious problems when it comes to lab testing for AMR. And it's a price that every family, every Nigerian is facing today, because we can't afford to pay for testing. When I'm having resistance, you understand, I have problem to test. Not just that. It's not every lab that can do that. So I think with the 10th anniversary coming on, it's something we should be looking at. Again, IPC. Every hospital you go to is not all hospitals that are practicing IPC. We still find out that some nurses or midwife or doctors can make use of just one glove to attend to more than 10 children. Yes, we've been screaming about this. So it's something too I want DASHA to be looking at. Thank you very much.
Thank you so much. You know what? I'm going to now invite, I should have actually done this, I'm going to invite Dr. Ibrahim Mohammed and Professor Onyebu Chichuku. Can we put our hands together for them, back on stage, so that they can address some of these concerns, and even the concern of the gentleman earlier. Nini, how much time do we have? Because I feel like this discussion can go on 5 more minutes. Okay, fantastic. Let's welcome Prof again and Doctor with another round of applause. So we just heard the question from the lady. Do you have a response?
Okay, thank you so much. I think that question is a very valid question, because before you identify antimicrobial resistance, you need to have a laboratory that is capable of doing this testing. Now, and testing of these microorganisms, does not only end at testing, because we have standards that we need to follow. And I've gone through a lot of hospitals in Nigeria, and the standards we need to follow to do these testings are the CLSI standard from the US or the UCAS standard from the Europe. Now, you will go through a lot of results from a lot of facility, and you see, somebody testing an antibiotics that you can never use it for that organism. Once you see that, there's a problem with that testing. But every laboratory in Nigeria need to be sanitized to use all this standard before we can say our results is valid. But for the facilities that we've gone through that use all this standard, they are also doing antimicrobial resistant testing is also additional funding, because once you send a result or a sample to the laboratory for testing, you know, culture and sensitivity, it will show sensitive to this and resistant to this. But it depends on the array of sensitivity and resistance. If you see resistant to like ceftriaxone, ceftazidime, which are third generation cephalosporins, so you need to anticipate that this could be an extended spectrum beta-lactamase producer. So you need to go ahead to do testing for that resistance. If you see resistance to carbapenems, you need to go ahead to do testing for carbapenems resistant testing, and this will come with another additional cost. So if we have, you know, healthcare, you know, funding that is not out-of-pocket funding, we have a good healthcare system that, you know, the hospital or maybe the funding aspect is taken off from the patient, I think it will be easier, so that once we see that, we'll just go ahead to do all this testing. But in fact, resistant testing are way expensive than the normal testing.
Test. And so, Prof, this is where I'll come to you now. What are your thoughts, especially on health insurance, you know, and how we can start to help, you know, families that might not be able to afford some of these testings, especially in the rural communities? You know, what are your thoughts on that?
Thank you very much. Why I was smiling, I'm sure you guessed, is something we've been talking. There's too much talk. But first, let me say that the principle which the champions have mentioned is what I stand for. Whatever small corner you're occupying in this country, either as a private citizen or you're working for government or a big corporate organization, is it possible you can do your best? Because I imagine that if all of us were doing our best at our various stations, then we won't be even blaming government, because we're all part of government in a way. But the idea of government is to provide that leadership, which is what the late Dr. Adadevoh provided for that hospital, what is called leadership. So that's why many times since we are blaming government, because government should provide leadership. We're not asking government to do everything. Now we're talking about hospitals. Do you know there are many local governments that have not seen a lab scientist, medical lab scientist in Nigeria? They are local governments. Even in my state, Ebonyi State, I was chief medical director, and that's not, well, it's far, but it's not too far. I'm talking about 2003, 2004, when two or three local governments produced their very first medical doctor. Don't ask those kind of local government whether they've seen a pharmacist. Of course, that's far-fetched. So the point I'm making is that I don't know how DRASA can make those who we should be talking to be in this hall, because we are singing to ourselves. These are all champions. They only know what we should be saying. From House of Rep. Thank you, Honorable. Thank you, Honorable. So one of the things we should be looking at is, rather than just buying, you know, when people say they are empowering people, one of the ways to empower people for politicians to actually to be buy community health insurance for them. Right. Then what they are saying will work. Not buying keke necessarily. Yes, keke is important, but if they don't have good air, they won't be able to use that keke too. Now, the problem really is what you said. People cannot afford even the cost of doing it. Then the second level of the problem is that we need to train people to know how to do these tests. And it has to be a diligent thing. 2 weeks ago, a relative sent me a lab result, urine. The way I was trained in University of Lagos is that you start with the name. So just looking at the name, it wasn't the patient's result. Anyway, let's continue.
So clearly, a lot of training for the health officials at primary care health level, insurance, community health insurance. You know whether we're donating that or just strengthening all the policies around that as well. Thank you so much, Prof. All right, do you have any questions online? Okay, yes. Let's have our member of the House of Reps make a comment. it looks like, I don't know if I'm getting ahead of myself. I know that the last time DRASA did an event was 10 years ago, but it looks like we might need to make this an annual convening. Who feels that? Who feels that? Let's celebrate that. Let's celebrate that.
Thank you. So good afternoon, everyone. Congratulations to DRASA, Mrs. Niniola Williams, and all the team members, champions at the school level, at the community level. This is really very exciting for me. I'm sorry I came late. I'm not a member of the House. I work with the Speaker as a special advisor.
Okay.
And I know that we do a lot of policy improvements, engagements, stakeholder participations like this. And we also tried in the course of preparation for this program to invite relevant stakeholders. But there was a protest today that prevented people from accessing National Assembly, and I think that affected some of the stakeholders that are supposed to be here from National Assembly. So I want to apologize on their behalf. So if you are speaking to community health insurance, I'm aware of the National Health Act, Health Insurance Act of 2017. I worked in Lagos. Lagos State domesticated the act to the State Assembly law in 2018. And I was privileged to be part of the team that birthed the Lagos State Health Management Agency that was to drive health insurance in Lagos. But guess what? 2018 to now is about 7 years, right? So recently I had a conversation with the permanent secretary manning that agency. And I was asking her, what are the issues in having a lot of people on board onto the health insurance? And so she was like, people are not willing to pay for health insurance, that they prefer to buy Ashwebi, and they believe that all is well. So I think the major gap, if you ask me, sir, is that general belief that all is well, one. Two, that health is expensive, or orthodox medicine is expensive. So I appreciate what you are doing on advocacy, on education, engaging the youth, the community participants. And I also like the contribution of the doctor about waste management. I think that is very key as well. And I would appeal to him if he has any resource in memorandum. Even from this kind of event, we should have a repertoire, take down important information that we can take back for policy improvements. We are open to receive such suggestions.
Fantastic.
On policy evaluations, on policy analysis, that would go into amendments to relevant acts. But implementation is key. Mm-hmm. So state governments, I want to appeal to them as well to reach out to state governments and local governments, because at the end of the day, the federal government is there for horizontal distribution of wealth, but the major players are at the local and state levels. And so this doctor, for instance, what state are you from?
Gombe.
Gombe. Honestly, he's a great champion. So such people should be well equipped, by their maybe chief medical directors, MOH at the local government, commissioners of health, so that preventive health care can spread information within stakeholder participants, because he is a stakeholder. What if they didn't take those proactive actions and measures? We won't be saying the same thing. So it's a win-win, and it's a symbiotic, relationship between government, between private sector, professionals, and community as a whole, and members of the household. So I am believing that we will get information from Mrs. Williams and her team, and I promise that I will deliver that to the Speaker of the House.
Fantastic.
And to the Chairman Committee on Health and Health Institutions and other stakeholders. Thank you.
Thank you so much for that commitment.
Just information.
Yes, sir.
Honorable, Jordan, please sit down. Thank you so much. You hit the nail on the head when you talked about implementation. At least I can speak for myself. In 2011, the Federal Executive Council released a national policy on waste management. which I signed, and the then Minister of Economy, a woman, I think from Kaduna State, also signed. And it's a long time. So I even guess there may have been an updated version. So it's with implementation. Nigeria has some of the best laws and best policies in the world, believe you me.
Thank you. Thank you so much. All right. We have a guest that we just want to quickly acknowledge, Dr. Jimoh Salahuddin, MNI, the Director, Hospital Services at the Federal Ministry of Health and Social Welfare. Dr. Jimoh, you're very welcome. So we're glad to have, someone from the Ministry of Health, Director of Hospital Services, also part of this conversation. All right, as we begin to wrap up the discussion, let me go back to our health champions. If I can just get a word from you all individually, just quickly, what are the things you're looking forward to going forward? It's been 10 years of DRASA, you've been part of, the program, you've had this training, you're already champions in your community and schools. What are you looking forward to? I'll start with you, sir.
Yeah, as health champions, one, I'll be happy if in my local government we have more capable hands to eradicate all these vaccine-preventable diseases, because when you look at my local government very well, it's one of the major places that, in fact, whenever we're having outbreak, it really affects lives of children and people in that area. Then we thank God for DRASA. This initiative has increased the level of case reportings, which might have been killing several number of people. We only pick data from health facilities, community members that find it difficult to take proper care of their bills. We never come to health facilities. So if we are having capable hands, that everybody in the community, as DRASA has said, first kind of it in history, that both the butchermen, fishermen, tailor association, mechanic association, everybody in the community now, they are
DRASA certified.
DRASA's sensitization team. So if we can be encouraging them, empowering them, it will go a long way in eradicating infectious diseases in our society. So I will be happy if that can be put in place. See something and say something. From you saying something, we bring something meaningful out. Thank you, sir.
Thank you so much, Mr. Sunday. So I guess it's about empowering the champions to reproduce other champions in the community. All right, Glorious.
Okay, so I would say that I've always known DRASA to be an advocate of change, bringing change to the system. So, DRASA has greatly impacted me. And one way that, one thing that I'm looking forward to is, DRASA going to primary schools, because left to me, I see people and the way they are growing, they are really growing fast, like very, very fast. If you see people that are in the university now, I have a friend, she's in 300 level and you don't want to know her age. So people are going fast and it's not too late, it's not too early. We start educating them about infection, about proper hygiene, how to take care of themselves, for the girls that are menstruating. Because I remember when I was in school, they taught me about that too. So it's not too early. We can start with the young ones. They are smart and they can pick things together and run with it.
Fantastic. Thank you. Thank you so much. Glorious, Precious. Who else noticed that their names rhyme? Glorious, Precious. All right, Precious.
Okay, thank you. I want DRASA to look into two things for this next decade. I want them to keep evolving, and I want them to look into the secondary school students and also the healthcare, especially nurses, as a nursing student. Because I see that we nurses, we are the closest to our patients. And whatever we do, I can say, okay, doctor can come to diagnose, but we nurses, we are the one that administer medication. We are the one that can advise them more. So I feel if DRASA look into healthcare, especially nurses, it's going to go a long way, because there are some nursing procedure like maybe checking vitals. people might not use PPE, that's personal protective equipment like glove. You just overlook it like, maybe it's vitals that I want to take, don't let me bother. In which it can go a long way, you using that glove. The patient might be a tuberculosis patient, you might not know. So if DRASA look into secondary school and nurses and nursing students, because nursing students will go for clinical posting, so they want us to learn. So we also have contact with our patients. It's going to go a long way. Thank you.
Thank you so much. All right, Dr. Ibrahim Mohammed, any final thoughts on, just to wrap up everything that has been said today? And then we'll end with Prof.
Thank you so much. One thing I also want to highlight here is the need for all healthcare workers to be trained when it comes to infection prevention and control. Not only the healthcare workers that will be restricted to operating as infection preventionists, but all healthcare workers should be trained and retrained when it comes to infection prevention and control. This is because every activities that we do in the facility will require getting to know some precautions to take, and also getting to know other things that will make us, IPC is not all about preventing transmission of infections to patients. It's also about knowing how to prevent transmission of those infections from patient to ourselves and to our patient relatives and to the community as well. And one thing for sure that is lacking in Nigeria is training of infection preventionists, and this training shouldn't be restricted to only IPC professionals, but it should be generalized to all healthcare workers. Thank you.
Fantastic. Thank you so much for that submission. Prof.
Congratulations once again, DRASA, your 10th anniversary. Well done for what you're doing. I'm happy you are not only talking. Talking is important, but you're also doing, which I consider more important. I believe you should use the opportunity of next year's ministerial high-level meeting that Nigeria will be hosting on antimicrobial resistance to also make yourself even known better globally. Find a way of using that opportunity. Then for the rest of us participants, can you promise us, maybe you promise us through DRASA today, that if you are not licensed, you are not trained to prescribe antibiotics, prescribe antimicrobials, you will not prescribe again, whether for others or for yourself?
We can make it a pledge. Everybody put your hand on your chest.
Okay, so you handle that.
No, you can even help us.
Handle that.
All right, so let's just make that pledge, as Prof has said. If you are not trained to administer antibiotics, prescribe, you will not. No self-medication. Thank you so much, Prof. Can we put our hands together for the former Minister of Health, Professor Onyebuchi Chukwu? Thank you so much for your submissions. And one more time, round of applause for this lovely panel. Let's stand for photographs. I think that after this conversation, you now know how important our endowment fund is to continue with these trainings at the community level. But I think that if there's anything that can be reiterated, it's just personal action, personal responsibility. Again, re-echoing what Nini said earlier about how our daily habits, taking better care of our individual health, our community health on a daily basis can go a long way to prevent outbreaks. So thank you so much for your attention. Fantastic. Thank you. Thank you so much. Who's excited? Okay, so we at DRASA, we aren't just health practitioners and infectious disease prevention officers. We also are people who have various other giftings and talents. And so we want to demonstrate that. Ogome has shown us that she can be a Michael Jackson if she's in a good mood. She can break out into dance. But we have people who are singers, who are spoken word artists and all of that. And so as part of today's celebration, we wanted to have a DRASA's Got Talent performance. And we have someone who we have to bring up. She has a flight to catch. We don't want her to miss her flight. So we're going to bring her up very quickly. Is Ore ready for her performance? Oh, she's not ready. Okay. All right. We also have this cake to cut. And, okay. Okay, yes, Ore is spoken word. All right, so just as we get Ore set for that, We still have a bit of a documentary to play. I think that we might save that for last as we're bringing the event to a close. We just have another short compilation of lighting testimonials of some of DRASA alumni, former staff of the foundation. Just speak very briefly. And right after this, we're going to have the performances from Ore Macaulay and nurse Christine Akowa. Yeah, okay. Yes, make some noise for nurse Christine. All right, so let's have the lightning testimonial.
I will describe DRASA as an indigenous and leading public health organization
that focuses on disease prevention and also strengthening capacity.
Hello. Whether they're up there in government institutions or at the grassroots in communities.
And over time, DRASA has been able to build resilience in communities and also shape our nation to be more healthy and safer.
So the first time I learned about DRASA was as an intern at the Nigeria Center for Disease Control and Prevention.
Before I joined DRASA, I worked as a lecturer at Ebonyi State University for 12 years.
The story of how I joined DRASA is definitely very unconventional. I was in my last semester of my vet school, and so I had a mentor then who please take all my complimentary cards and let us identify the ones that are working on public health, and DRASA stood out.
Personally, it was actually a friend that told me, look, remember the incident that happened, I think, at the Ebola? There's an organization that was set up. I was like, wow, I didn't hear about this.
It's a funny story for me, actually. So I applied for another job. I didn't even know about DRASA at the time, but we couldn't conclude for that job.
A mentor had sent a link to say, this organization is actually looking for a comms person. 24 hours apart, another person had sent a link to say, there's this organization that is looking for a communications officer.
It's an organization, they're now into public health. This is what they do. And maybe from you, the place for me. And I said, okay, I will check them out.
My interviewer did say to me that there is an organization that was looking for someone that has my skills at the time, and if I don't mind, she could recommend me.
So it then goes on to say, send an email and pretty much ask for a job. And so that was the first time that I was shooting my shot for a job that did not exist. So I sent in my cover letter and my CV asking to be a graduate intern at DRASA.
So I applied, got an interview slot. Thankfully, I was able to, get the role, and I joined, and I did the best that I could within the 3 years that I found myself there.
And that was how I got referred to the MD at the time, and she reached out and we had a conversation. Then, of course, she scheduled an interview for me, and that was how my story started.
So from there, I got a response to my email. I got in, and the rest is history.
And I got in contact with the managing director, and long and short of the story, I now passed through DRASA.
And what motivated me to join at that point was the outcome of my PhD research. When I saw the opportunity to work with DRASA to influence policy development that will shape the AMR space, I embraced that opportunity and joined DRASA.
Working at DRASA taught me a lot of things, and if I were to count them, I won't finish today.
One thing that working at DRASA has taught me is how to do proper documentation.
One of the key ones that stood out for me was the importance of clear communication.
I learned cultural intelligence, understanding how you can shift your calibrations to accommodate other person's peculiarity or their personality.
I learned how to be very diplomatic from when I worked at DRASA, how to work with people. So sometimes it's not just about the work, it's also about the people.
Can we just make some noise for the humans of DRASA? Can the humans of DRASA make some noise? All right, remember we're still celebrating DRASA 10, and these are the people who over the last 10 years have made this possible. So it's very important that we highlight and celebrate them. All right, so Ore Macaulay is ready. She is also, is she still at DRASA or an alumni? Well, did she work at DRASA at some point? Okay, but she's just a champion and a friend of DRASA, and so she will be doing spoken word performance. And I've been told she's actually a professional spoken word artist and does this performing all around Nigeria and internationally as well. Ladies and gentlemen, Ore Macaulay.
Going live in 3, 2, 1, rolling.
Good afternoon, Nigeria, and welcome to the news at 12 o'clock. This is to bring to your attention urgent and breaking news from all over the country about the prevailing rise of what has been termed the silent pandemic. Its impact is gradual but devastating, with projections suggesting that it could be the leading cause of death by 2050 if unchecked. So please stay with us for more details. Thank you. You see, in the distant rural land of Anibagbo, Abimbola is on his way home from his mother's funeral, where he gets involved in a car accident that throws him into a ditch where he breaks his leg. Abimbola is on his way home from his mother's funeral, where he gets involved in a car accident that throws him into a ditch where he breaks his leg. And after 3 months of intense treatment, highly aggressive and drug-resistant Acinetobacter baumannii infection claims his leg, and then his life. 3-year-old Abdulrazak has a recurring ear infection. A devastating visit to the hospital reveals that he has MRSA. And now, his parents had to choose between surely losing their son or allowing the doctors try a new drug that could maybe work, but will definitely damage his internal organs. And now, Abdulrazak, he has speech and mobility issues. And while some would say that this is a happy ending, is it? Really? At least he's alive, right? But do you know that the next child may not be so lucky? A 19-year-old beats cancer. A 19-year-old cancer survivor loses her life to the Candidae fungi. Painful and drug-resistant E. coli infection tears a man's life apart and renders him homeless because he can no longer work and fend for himself. Rebounding and retreating flesh-eating bacteria leads to septic shock and the death of a young doctor. You see, this silent pandemic is causing loud loss, and we can no longer afford to be unbothered, ignorant, or quiet. Antimicrobial resistance is urgent, and it is very real. And we see it day after day in the lives of those around us. These are not just numbers. These are not just stories. These are lives being torn apart because antimicrobial resistance is urgent and it is very real. Here's why. You see, these germs adapt, evolve, and defy. While old defenses fade and die, these microbes grow and they become stronger. While antimicrobes have become weaker. So now, whispers of warning grow through the year. Resistance is growing, the world should hear. This silent pandemic is loud loss. Antimicrobial resistance is urgent and it is very real. But there is a fighting chance. There is a fighting chance in every clean hand. There is a fighting chance in every doctor's pause before prescribing. There is a fighting chance in farmers who decide to do better. There is a fighting chance in active surveillance and monitoring. There is a fighting chance in collaborative effort from all our stakeholders. There is a fighting chance in you and I only taking what we need. There is a fighting chance in every patient only using antimicrobials when necessary. There is a chance to slow the tide. We must make this a priority nationwide. Because to do so is to guard the seed past has sown. By using carefully the antidotes we already know. This silent pandemic is causing loud loss. Antimicrobial resistance is urgent and it is very real. There is a fighting chance and fight we must. So today, we highlight one of the frontline soldiers in this battle. Built on the legacy of a very brave hero we must honor and never forget. Dr. Ameyo Stella Adadevoh and the Health Trust. This icon is fighting the good fight. From active contributions on Nigeria's AMR Coordination Committee, from active contributions on Nigeria's AMR Coordination Committee, to facilitating the development of Nigeria's National AMR Action Plan. DRASA is waging war on AMR through policy and advocacy. This fighter is taking the war to the streets, to families. This soldier is taking the war to the markets, to our community leaders, and even to our politicians. They are taking the message to the everyday Nigerian by revolutionizing AMR communication in various languages. You see, DRASA is ensuring that by raising awareness, by community and youth engagement, they are building a hopeful future through education and enlightenment. By establishing AMR clubs and AMR education in secondary and tertiary schools, DRASA is building a hopeful future. DRASA is revolutionizing the communication on AMR. And by doing this, they are protecting us all. By taking the message to the streets, beyond the classroom and hospital walls, with urgency, its voice calls for partnership, for collaborative action, and for proactive intervention. You see, the work DRASA is doing has the result of protecting us all through public awareness and infection prevention. This silent pandemic is causing loud loss. Antimicrobial resistance is urgent and it is very real. So, Iyalode, no talk say because your body don't cool, your temperature don't go. You don't go finish the medicine where your doctor write give you. Iyalode, no talk say you know what they do you, they wrong, go chemist, go buy antibiotics. No be so, umbano. Make sure you go hospital, make doctor do tests. Let us know what is wrong with you. You get cold, you get cough, you get catarrh. No be antibiotics matter. I'll say that again. You get cold, you get cough, or maybe even catarrh. Antibiotics matter. Mommy, oh yo yo. Daddy, oh yo yo. I know your children are scared of nurse alabere, but that vaccine can save your lives and even the lives of their own children too. I know you want to carry your grandchildren, but it starts with you and how you preserve the lives of your own children. Bro, South Bar now. You did for traffic, you know wahala. But before you chop that egg roll where you just buy, make sure you buy pure water and carry that soap where you put for bag, wash your hand well. How about your fruits, Mr. Lawyer? How about your meat, Mr. Doctor? You take it home and you put it in your fridge without proper cleaning and sanitizing. Don't be so. Antimicrobial resistance is real. It is urgent. And this isn't fear. It is a call to care from our farmers to our doctors to Mr. President and my dear friends. This is our fight. And it doesn't end. These microbes may be resistant, but they must meet our Nigerian resilience. Say that again. And this is the time where you make a pledge and say after me, these microbes, oh, I'm not sure that you're here. Have you been following? This is the time where you make a pledge and say after me, these microbes may be resistant, but they must meet. You don't sound like a confident Nigerian. We'll do it again. These microbes may be resistant, but they must meet my Nigerian resilience. These microbes, they may be stubborn, oh, but we too go show them, say we get strong head. I need your attitude. Can we say it again? Can we say it again? I can't say it again. All right. These microbes may be resistant, but they must meet my Nigerian resilience with attitude. These microbes, they may be stubborn, no, but we too go show them, say we get stubborn heads. Antimicrobial resistance is urgent and it is real. This silent pandemic, though silent, is causing loud loss. Congratulations to DRASA on 10 years. Wishing you more impact. Thank you.
Ladies and gentlemen, celebrate Ore Macaulay. She's a writer, lawyer, performance poet, public speaker. She's also an author of a poetry collection called A Tale I Ought to Tell. She has done over 200 live performances and 100 plus published poems. And she effortlessly bridges the worlds of art and advocacy and has worked with renowned artists such as T.Y. Bello, Gaze Baba, Falabi Noel. She's worked for Dettol, MTN, Stambik, IBTC, and the list is endless. One more time for Ore Macaulay, ladies and gentlemen. That was really beautiful. I love that you said that this isn't about fear, it's about care, and we have a fighting chance. So tell your neighbor, we have a fighting chance. You know, when we individually take responsibility, that's the fighting chance against AMR and all the other diseases that we're, you know, finding resistance against with our own Nigerian gragra. I love that. All right, we have another performance. This next performance, this person, yes, exactly. She's actually a staff of DRASA. All right, so can we make some noise for Nurse Christine Akoa? She's a certified nurse midwife, proud alumna of Babcock University, holding a Bachelor of Nursing Science and dual registration as a nurse and a midwife. She has clinical experience, a passion for infection prevention and control. And you know, her bio is really, really long. But at DRASA Health Trust, Christine's impact, growth, and drive show that thoughtful transformational leadership lends to a woman as a rising trailblazer in the public health space. Ladies and gentlemen, to do a performance, make some noise for Nurse Christine.
Good afternoon, everyone. It's a privilege to be before us and being a part of the team making great impact in Nigeria in the public health landscape. We have a song, but for me, it's beyond a song. It's an opportunity to appreciate DRASA Health Trust, an opportunity to, you know, lyrically present in harmony the vision and the mission behind the work we do. And I hope that we as well, listening, would get the impact that we do in melody, aside the fact that we do great work. Thank you. So we are ready.
Gone by when skies were gray, 10 million whispered words that day, but our country trembled, hearts unclear, and then came a doctor, brave and dear, with gentle hands and steady sight, she rose to hold Nigeria's bright light. We lend, we care, we stand as one. Dr. Stella lives on, we find a voice. So come join the chorus, join and rejoice. Yes, she lives on, her touch we bear. And from our own shores to everywhere. Yes, she walked through fear, she walked through night, but her courage served her purpose bright. Though evil arrow death played, but her flame ran steady through the fray. With gentle hands and steady sight, she rose to hold Nigeria's bright light. Yes, we lend, we care, we stand as one. Dr. Stella lives on, we find a voice. So come join the chorus, join us and rejoice. Yes, she lives on, her touch we bear. From our own shores to everywhere. And this is who we are.
DRASA plants the lessons.
As you meditate,
She tends the seed.
pick the words.
While we work,
Know us for who we are.
we guard, and we meet the need.
Yes, we meet the
in
need.
schools and clinics, towns and halls. We keep her name, a call to all. So hush now, little one. Rest your head. The flame keeps watch while you are led. It's her work, her courage, that we won't forget. Her legacy, DRASA Health Trust, it won't sunset. So no harm, no fear, that's how we fight.
That's how we
For her light will always guard the night.
We stand tall.
She lives on. We are her voice. We stand tall, and that's our choice.
And forever we will remain grateful for the late Dr. Adadevoh. Thank you for the opportunity.
If you're still sitting down, you're in a very long tent. Make some noise. Ladies and gentlemen, I thought that was really wonderful. That was truly, truly wonderful. So we're premiering this song for the first time. This is the first time we're hearing the song, but we'll make it available on the DRASA pages, right? We need to release it, probably even do a music video. You know, we really need to pass this message on. It sang like a hymn in church, right? And you know, usually after this sort of stirring performance, what happens next? Tithe and offering. So I'm going to now draw your attention so you can pay your tithe. And now the barcode will still be on the screen, but actually behind your tag, you'd find the barcode. On the program for today, there's also a barcode. Now we understand it's a lifelong journey we're committed to at DRASA Health Trust. So it's okay to make a pledge today. It's okay to commit to make a pledge going forward. Remember, we have a fighting chance, and it's all of us together. I am personally going to make a pledge myself and not just do the talking. So can we all make that commitment to pledge to support and to continue to support DRASA Health Trust? Now we're going to cut this lovely anniversary cake. Who again is excited for DRASA Health Trust at 10? All right, so if the team can help us, we want to move the cake to the center so we can call on our managing director, members of the board of the trustees to cut the cake. It'd be nice to have some music in the background. We're in celebratory mode right now. And the NCDC. Did I get that right? Okay, yeah. And we'll have reps from NCDC also join us to cut the cake. But let's have some music in the background as we get in the cake ready. We're really delighted for 10 years of just tremendous impact. Is the board chair around? Oh, fantastic. Okay. The board chair, he's very self-effacing and sometimes doesn't like to be put under the spotlight. He will deliver votes of thanks later, but can we just celebrate the board chair of DRASA Health Trust, Mr. Bankole Cardoso? Can you just stand for recognition? Make that round of applause loud for our board chair. All right, so can we just invite the chairman, the board chairman? Can we put our hands together for them? The board chairman, the managing director of DRASA, the representative from NCDC, the Ministry of Health as well. Sir, please come forward. CD, the Chief Veterinary Officer of Nigeria as well. The former minister, please join us, Professor Ebuchi Chukwu. Yes, it's very ad hoc. Nini will pull everyone that needs to be pulled forward. All right, our friend from Kenya. You can make that volume loud. While we're getting ready to cut to the cake, everybody will be dancing from side to side. Turn the volume up. Are you ready? Okay, let's do a dance. 1, 2. This is a DRASA Health Trust dance. Everybody. You're not dancing, sir. You're not dancing, sir. Prof, we need to see your dance steps, Prof. That's the spirit. That's the spirit. Can we put our hands together for them one more time? Okay. Thank you. You can bring the volume down. So, trust me, for whatever reason, the knife is not here. I think someone has gone to sanitize the knife. And just so that, I don't know if we would need 24 hours to remove all the microbes and microorganisms on the knife. All right, so whilst they're sanitizing it, we'll stretch our hand to the cake. So we'll just imagine there's a knife there. So Banky's hand. Aha, very good. Now everybody just stretch your hand to Banky. Now we're going to spell DRASA and the cake will be cut. Can we do that together? Okay, the knife has been sanitized. It's here now. Can we put our hands together for our nurse? You are not clapping for her now. Aha, fantastic. Okay. So can I get a D, a loud R, a thunderous A, an intentional S, another loud A, and what does that spell? DRASA. Put your hands together, come on. For 10 years and beyond, we say congratulations to DRASA, and may the good Lord continue to guide and protect and keep you as you continue with the good work. Hip, hip, hip. Hip, hip, hip. All right. Turn the music up. Let's have a few more pictures. Those who are part of the board, friends and family who haven't come for photographs, please join us. Congratulations again for a decade of impact and inspiring the next generation to champion hygiene, safety, and health security. Congratulations to the DRASA Health Trust Board and Management. Thank you, Board Chair. I've held back our Board Chair to just greet you, say a few words, and deliver a vote of thanks. Ladies and gentlemen, another round of applause for Mr. Bankole Cardozo.
Good afternoon, everyone. I stand on existing protocols, and this is just a vote of thanks to, first of all, thank you all for your patience and being with us for these last 4.5 hours. It's been a very exciting and filled program, and we're very grateful that you could be with us for that. So, to our government partners, the Presidency, the Federal Ministry of Health and Social Welfare, the Ministry of Environment, the Federal Ministry of Livestock Development, the Nigerian CDC and Prevention, state ministries, local government authorities, health workers in clinics, and to all of our stakeholders across the borders. We thank you so much for all of your support. To our funders and donors, individuals, companies, corporations, foundations, institutions, and agencies, from the very early believers who invested when prevention sounded abstract, to our current partners, and to you for helping us scale, we thank you. Thank you for believing in us, and thank you for investing in our mission. To our technical partners, your expertise has multiplied our impact. Thank you to our global and regional health agencies and professional societies that co-design guidelines, toolkits, and intervention with us. We thank you to our academic partners, trainers, and simulation partners who strengthen our curricula, IPC, training, and research. Our shared work has turned ideas into systems and pilots into scalable models. To our current and former staff, consultants, facilitators, volunteers, and our online community, thank you. To our board members, thank you. The strategic guides and steady hands that have steered DRASA for a decade, we thank you so much for all your wisdom and direction. I would like to name a few of our board members who are no longer on the board due to competing interests with the federal government, I can put it that way. So to Dr. Mohamed Pate, who is the current Minister of Health, he was an advisory board member of DRASA from day one. To Mr. Olayemi Cardozo, who is the governor of the central bank, he was also a board member of DRASA from day one. To our other board members who are also no longer on the board, Mr. Olashupo Shashore, we thank you so much. And to his whole team at ALP, Africa Legal Practice for all of their pro bono support to DRASA in the last 10 years. To Mrs. Efundoyi Akinyoju, we thank you for your steadfast support as a board member. To our community health champions and youth leaders, you are proof that ordinary people can drive extraordinary change. And to the families of all of our fallen heroes, we acknowledge their sacrifice and their service. Lastly, I want to just thank our event and production collaborators for today, the teams, the venue, the technical crew, the ushers, the security, logistics, and hospitality partners. Thank you for helping us host a safe, smooth, and memorable celebration. A couple of people have come up to me today to say that there should be an annual celebration. So maybe we'll head in that direction. So to our mentors and the Nigerian diaspora community, who have also been very strong supporters of DRASA, your encouragement and advocacy and generosity have always been felt behind the scenes and in the forefront. We see you and we thank you. And to our media and communication partners, we thank you. To our families and friends, we thank you. I want to give a special thank you to Oluwaseun P as well for emceeing a wonderful event. Oluwaseun was also the MC 10 years ago today when we launched DRASA. And it was fate that he was here today, because about 3 days ago, he was not going to be emceeing this event, as he would not have been in Abuja. So thank you. And I would like to give a special thank you and shout out again to our Managing Director, Mrs. Niniola Williams. And a standing ovation for her, please. And lastly, we thank God. And again, we thank you all for being with us and sharing this memorable celebration and anniversary with us today. I believe with that brings a close to the event. I'll give it back to our MC, but I think lunch should be served. So, thank you.
Ladies and gentlemen, one more time for Mr. Bankole Cardoso, the board chair. As Bankole has said, there's so much to eat. All those who have left have missed. All right, so please eat ×2, you know, since we have 2 halls for lunch. The ushers will direct you once you step outside. There are 2 separate halls for lunch. Just to be sure that there's nothing else left on the agenda, the DRASA Health Trust short film that we didn't get to finish will be available on YouTube and online. Remember that barcode gives you access to everything. So please scan that barcode and, you know, bookmark it and save it and visit it every now and then so you can stay in touch with what we're doing. Thank you all so much for coming. Lunch is served. Bon appetit. It's been an honor to serve you. If there are any other rounds of pictures we haven't taken, let's do that before we go for lunch. Nini, yes. We just want to have a couple of photographs, so we'll just run that behind the scenes before we step out for lunch. Thank you so much. Stay connected with DRASA Health Trust, and hopefully we'll see you next year. Hopefully. God bless you. Okay, so photographs. Faustina.
Healthier day, prevention first, the change we bring with every heart, with every hand, we protect.